The badge hit the floor at 7:42 in the morning, and everyone in the emergency department heard it. Dr. Marcus Theld pointed at the exit like he was erasing a mistake. "Get her out of my hospital." Security moved fast. Nurse Mara Calloway didn't fight it. She picked up her jacket, left her stethoscope on the counter, and walked out into the October air without a single word. 41 seconds later, the ground shook. 3 miles east, the Carver Industrial Refinery detonated in a column of fire that turned the sky orange over Dunmore, Colorado. And the woman they'd just thrown out turned around and walked back in. Well, before we go any further, if you're the kind of person who watches a story all the way to the end, this channel was made for you. Hit subscribe right now so you don't miss what happens next, because this one goes places you won't see coming. Tap the like button if you're already hooked, and drop a comment telling me what city or country you're watching from. I want to see exactly how far this story travels. Now let's go back to the beginning. The shift had started the way most October Mondays started at Dunmore General Hospital, understaffed, overlit, and already running behind before 7 a.m. Mara Calloway had been working the emergency department for 9 years. She knew the rhythms of the place the way some people know the layout of their childhood home. The particular squeak of the supply cart near Trauma Bay 2, the way the overhead fluorescents buzzed louder near the nurse's station, the difference between the sound of a monitor alarming because of a loose lead versus a monitor alarming because something was actually wrong. She heard those things the way musicians hear off-key notes, automatically, without trying. She was checking medication orders at the dispensary station when she caught it. Room 7. Elderly male, 73 years old, admitted the previous evening for atrial fibrillation with a documented history of severe kidney impairment. The order in the system, stamped with Dr. Marcus Theld's authorization at 6:58 a.m., listed a loading dose of amiodarone at a concentration that would have been appropriate for a patient with normal renal function. This patient did not have normal renal function. Mara pulled the chart. She pulled the lab values from the prior evening. She did the math in her head, double-checked it on the back of a supply requisition sheet, and came to the same number both times. She walked to the pharmacy window. "Don't dispense room 7's amiodarone." The pharmacist, a tired-looking man named Grant, looked up. "It's already queued." "Hold it," Mara said. "I'm going to get the order corrected." She found Dr. Theld at the attending physician's workstation near the center of the department, a long, curved desk that gave a clear sightline to all 12 trauma bays. He was tall, unhurried, the kind of man who took up space in a room without appearing to notice he was doing it. He had been the head of emergency medicine at Dunmore General for 6 years, and he moved through the department the way people move through places they consider personally owned. "Dr. Theld," Mara kept her voice even, "I need to flag the amiodarone order for Mr. Garrett in room 7. The dose is calculated for standard renal function, but his creatinine from last night puts him at stage 4 CKD. At that concentration, we're looking at serious toxicity risk." Theld didn't look up from the workstation. "I reviewed his chart this morning," he said. "I understand, but the dosing guideline for—" "I reviewed his chart." He said it the same way the second time, slower, like the problem was that she hadn't heard him clearly. "If you have concerns about how I manage my patients, I'd suggest you take them to someone who reports to you." Mara stood still for a moment. "I can pull the renal dosing protocol right now. It takes 30 seconds. He looked at her then. It was a specific kind of look. Not angry, just dismissive in a way that was almost worse than anger. The kind of look that communicated she was slightly below the threshold of things worth being angry at. "Calloway." He turned back to his screen. "Go do your job." She went back to the pharmacy window. "Still hold that order," she told Grant. Then she documented everything: the lab values, the calculated creatinine clearance, the protocol reference, the time of her verbal flag to the attending physician, and the time she placed a secondary flag in the electronic record. She noted that the order had not been corrected as of 7:18 a.m. She sent a message to the charge pharmacist. She was still at the terminal when Dr. Theld appeared behind her. He had another physician with him, Dr. Yolanda Ferris, the department's administrative director, who oversaw nursing staff evaluations and had the authority to issue formal disciplinary actions. Ferris carried a tablet and looked like someone who had already made a decision before arriving. "Ms. Calloway." Theld's voice was different now, formal, carrying. Three nurses near the supply room looked up. A resident at the far end of the department turned. "I'm told you placed a pharmacist hold on a medication I ordered." "I flagged the order and requested it be reviewed," Mara said. "I documented my clinical concern in the chart." "You blocked a physician's order." "I requested a hold pending clarification. That's within nursing scope." "What's within nursing scope?" Theld said, and his voice had risen enough now that it wasn't a private conversation anymore. "Is carrying out orders from licensed physicians, not countermanding them. The patient has stage 4 CKD. The dosing, I know what his kidneys look like." He took a step closer. "Not threatening, exactly. Just deliberate. What I'm not clear on is why a floor nurse thinks she has the clinical authority to override attending physician judgment." The department had gone quiet in the specific way emergency departments go quiet when something is happening that isn't a patient emergency. The ambient noise, the monitors, the ventilator hum, the distant PA system was still there, but the human noise had stopped. "I'm not overriding anything," Mara said. "I'm asking for the order to be reviewed." "You're a nurse." He said it without inflection, which somehow made it worse. "You're not a pharmacist, you're not a physician, you're not a clinical pharmacologist. You're a nurse, and you have placed a hold on a time-sensitive cardiac medication because you decided your 9 years of floor experience outweighs a physician's board-certified judgment." "I think the lab values outweigh anyone's judgment," Mara said, "mine included." That was when Ferris stepped forward with the tablet. "Ms. Calloway," Ferris said, "given the nature of this incident and Dr. Theld's formal complaint, we're placing you on immediate administrative leave pending a full conduct review." Mara looked at her. "Right now." "Right now." She looked at Theld. He wasn't looking at her anymore. There was a lanyard around her neck. Her Dunmore General ID badge. 9 years of it. The photo from when she still wore her hair differently. The little colored stripe that indicated her clearance level for the medication dispensary. She pulled it off. For a moment she considered placing it on the counter carefully, but something in her decided against that particular courtesy, and she set it down flat on the desk next to the keyboard. "The patient in room 7 needs his order corrected," she said. "That's not me overstepping. That's just a fact." Nobody answered her. She got her jacket from the break room. She left her stethoscope on the counter near her locker. A small Litman cardiology that had been with her longer than most of her professional relationships. She picked up her bag, walked through the ER bay, pushed through the automatic doors, and stepped into the parking lot. The October morning was cold enough that her breath showed. She stood next to her car for a moment without getting in. She was angry. That was fair. She let herself be angry for approximately 40 seconds because she figured she had earned that much. Then the ground moved. It wasn't violent at first. It was more like a deep vibration, the kind that comes up through your feet before your ears register anything. Then the sound arrived, a low concussive roll that was too big to be thunder and came from the wrong direction, from the east, from the industrial stretch of Dunmore that housed the refineries and the tank farms. Mara turned. The column of fire was already visible above the eastern tree line, black smoke muscling up into the orange. Even from 3 miles away, she could see secondary flares catching, smaller explosions inside the larger one, which meant fuel storage, which meant this was not contained and was not going to be contained quickly. She stood in the parking lot with her keys in her hand. She knew exactly what was about to walk through those emergency department doors. Mara Calloway had spent 4 years before nursing school doing something that wasn't on her resume. Not because she was hiding it, exactly, but because she had found that the people who asked about her background tended to get uncomfortable when she answered honestly, and uncomfortable supervisors made for complicated workplaces. She had deployed 3 times with a specialized Army medical unit that operated in environments where conventional hospital infrastructure didn't exist. She had managed blast injuries in forward operating positions with 2 pairs of hands and whatever the trauma kit contained. She had triaged mass casualty events in conditions that would have been classified as impossible by any standard emergency medicine textbook. She was 34 years old. She had been out of the service for 5 years. She had built herself a quiet life in Dunmore, worked a 9-year career as an ER nurse, and she had been very deliberate about not bringing who she used to be into who she was now. The smoke column was spreading. She thought about the room 7 patient, Mr. Garrett, 73, atrial fibrillation, kidneys that were already struggling. She thought about the residents on shift this morning, 2 of them second year, one of them who had been in the department for 11 days. She thought about the triage protocols for mass casualty events and the fact that Dunmore General's MCI plan had last been tested 18 months ago during a tabletop exercise that, in her opinion, had not gone well. She put her keys in her jacket pocket. She walked back through the automatic doors. The department was already different, not chaotic yet. That would come. But the particular stillness that precedes chaos, when people sense something is wrong but haven't yet received permission to react. 2 nurses were at the window of the ambulance bay, looking east. The charge nurse, a heavy-set man named Brent Calso, was on the phone with someone, his face doing the specific thing it did when the information he was receiving was worse than expected. Mara went to the central workstation and pulled up the triage board. 12 beds currently occupied. 3 patients in the ambulance queue. 3 physicians on shift. 1. Theld had just used the last of his administrative energy firing her and was presumably still at the far end of the department, feeling self-satisfied about it. She did not go to Theld. She went to Brent. "What are you hearing?" she asked. Brent covered the phone receiver. "Carver Refinery. Multiple explosions confirmed. EMS is saying preliminary estimate of casualties is..." He stopped. His mouth did something complicated. "They're saying it could be 40 to 60. Mara looked at the 12 occupied beds, the 3 physicians, the triage board. "What's your MCI threshold?" she asked. 20. "You're going to hit 20 in the first wave," she said. "You need to start clearing beds right now. Anything ambulatory that isn't actively deteriorating goes to the family waiting area. Call in every off-duty nurse and tech you can reach. You need 2 people on triage at the ambulance bay door, not 1, 2, and you need them sorting before patients cross the threshold." Brent stared at her. "You're on administrative leave." "I know," she said. "Do you want to talk about that right now, or do you want to clear beds?" Brent made a decision. He made it in about 3 seconds, which was faster than most administrators could have managed. He got back on the phone. Mara went to the supply room and started pulling trauma carts. The first ambulance arrived 8 minutes after the explosion. Then the second. Then 4 at once, which meant the system was already breaking down because EMS units were transporting without waiting for staging instructions. Burn patients, blast injuries, inhalation cases. They came in layered with soot and shattered glass. Some of them walking and disoriented, some of them not walking at all. Mara worked triage at the door because nobody else was doing it with any system. She used a color tag method she'd learned in a different context, in a different country, under different circumstances that she didn't think about while she was working. Red tags on the threshold patients, compromised airway, uncontrolled hemorrhage, signs of shock. Yellow tags on the serious but stable. Green tags on the walking wounded who were frightened and bleeding but not dying. She did not think about her administrative leave status while she was doing this. The second-year resident, a young woman named Dr. Paloma Reyes, appeared at her elbow within the first 10 minutes. Reyes had been in the department for less than a year and had the kind of face that showed every thought she was having, which right now showed controlled terror. "What do you need me to do?" Reyes asked. "Trauma Bay 1 and 2 are yours," Mara said. "Airway first, hemorrhage second, vitals third. Don't get anchored on any single patient. If you're spending more than 8 minutes on one person and they're not stabilizing, you call me." "You're not..." Reyes stopped. "Okay. Go." Theld appeared somewhere around the 12th patient. He came through the interior corridor from the administrative wing, and Mara saw the exact moment he registered what was happening. The triage tags, the cleared beds, the systematic flow she had established at the ambulance bay door. His expression did something she didn't have time to interpret. He walked to the central workstation. He started typing something. He did not come to the ambulance bay. Mara did not have time to find this surprising. What she had time for was the next ambulance, which arrived with a patient that was different from the others. A 16-year-old boy, the paramedic said, had been working a summer job at an auxiliary facility near the refinery's eastern perimeter. He had been found unresponsive approximately 200 meters from the primary blast site. No burn involvement, no obvious external trauma. But when Mara looked at him, at the asymmetry in his pupils, at the posturing in his left arm, at the way his blood pressure was climbing while his heart rate dropped, she felt something crystallize in her chest with the cold clarity of certainty. Epidural hematoma. Probably arterial. Possibly already herniation. She looked at Brent. "Where's neurosurgery?" Dr. Felsner is the on-call neuro. His helicopter was grounded because of the smoke. Who else? There's nobody else in network. Nearest neurosurgeon is 45 minutes by ground. Mara looked at the boy. His name was on the paramedic sheet. Tobias Wen, 16 years old, summer job, found unresponsive. 45 minutes was not a number Tobias Wen had. She reached into her jacket pocket and took out her personal cell phone. The contact she dialed had a single initial in her phone book, just the letter R, and she had not called this number in 2 years and 4 months. It rang twice. "I figured I'd hear from you eventually," said the voice on the other end. Male, unhurried, the ambient sound of something institutional in the background. "I need a walkthrough on an emergency burr hole," Mara said. "Suspected epidural, arterial bleed, patient is 16, GCS is dropping, nearest neurosurgeon is 45 out." A pause. Not a long one. "What do you have for equipment?" "I'm in an ER. Full kit, but no neuro tray." "You can make a neuro tray. I'll talk you through the setup. What's your ICP presentation?" "Cushing's triad is developing. Right pupil blown, left sluggish. He's been down approximately 22 minutes. "Okay," said R. "Tell me what you see when I ask and don't editorialize." "Ready?" "Ready," Mara said. She looked up. Paloma Reyes was standing 6 feet away, staring at her with an expression that had passed through controlled terror and arrived somewhere new. Around her, 3 nurses and the other second-year resident had gone completely still. They had all heard enough to understand what she was about to do. Mara met Reyes's eyes. "I need a sterile field," she said, "and I need everyone in this room to make a decision right now about whether they're in or out." Nobody left. She worked for 23 minutes. She did not think of it as 23 minutes while it was happening. Time compresses in those situations in a way she had learned to use rather than fight, each step discreet and complete before the next one began. The procedure was not clean. It was not textbook. The voice on the phone walked her through 2 complications she hadn't anticipated, and she solved them the way she had always solved problems in conditions like this, by knowing what mattered and ignoring everything that didn't. When Tobias Wen's monitor showed the pressure beginning to equalize, when his left pupil, which had gone fully fixed, began the slow return toward reactivity, Reyes made a sound that was not quite a word. Mara straightened up. Her hands were steady. She was aware that they should have been shaking. The phone in her pocket was still on. She pressed it to her ear. "He's stabilizing," she said. "Good," said R. "I'll file the consult documentation from my end. You're covered." She hung up. The trauma bay was quiet in a way that had nothing to do with the ongoing chaos outside its doors, the kind of quiet that forms in the immediate aftermath of something that should not have been possible. Mara looked at the team around her. Reyes, the nurses, the resident whose name she still didn't know. "Someone needs to be monitoring his pressure every 4 minutes," she said. "And we need to get Dr. Felsner on a video call as soon as he's reachable, because this patient needs proper neurosurgical follow-up within the hour." Nobody answered immediately. They were still looking at her in that particular way. Then the ambulance bay doors opened again, and the next wave of patients came through, and the room came back to itself. Mara went back to work. She did not see the black vehicles when they first arrived. She was deep in Trauma Bay 2 with a blast injury patient who had a chest wall defect that required management. It was Brent who found her, touching her elbow with the particular carefulness of someone approaching a situation they don't have words for. There are people outside," he said. "Military. 3 vehicles." Mara did not stop what she was doing. "How many people?" "I counted 8, maybe 10. One of them is in a colonel's uniform." She finished the chest seal. She handed off to Reyes. Then she walked toward the ambulance bay doors, still in her gloves, still with the particular stillness in her body that came from doing work that required everything and left nothing over for performance. Through the glass panels, she could see them in the parking lot. 3 black SUVs, government plates, doors open. Personnel in tactical medical gear, some in uniform, moving with the efficiency of people who had protocols for exactly this kind of disaster and had executed those protocols before. The colonel was standing apart from the others, looking at the building. He was older than she remembered, broader at the shoulders, more gray, but his posture was the same, the stance of a person who has stood in worse places than a Dunmore, Colorado parking lot and found them manageable. His eyes found her through the glass. He did not look surprised. In fact, and this was the thing that made the nurses standing behind Mara go quiet in an entirely different way than they had been quiet before, he came to attention. Not a formal salute, not a performance, just the instinctive correction of posture that happens when certain people enter a space, a physical acknowledgement so automatic it bypasses thought. Mara pushed through the doors. The cold air hit her. The smoke from the Eastern District had reached the hospital now, a thin, acrid edge on the wind. The colonel looked at her across 20 feet of parking lot. "Calloway," he said. "Colonel Voss," she said. Behind her, through the glass, she was aware that Theld had appeared at the nurse's station, had been there for some time, in fact, watching. She did not turn around to look at him. Colonel Voss walked toward her, and behind him his team began moving toward the hospital entrance with the controlled purpose of people who had been waiting for exactly this signal. "We had your location flagged," Voss said, quietly enough that it was just between them. "When the alert came in, I pulled your file." "I'm on administrative leave," Mara said. Something moved at the corner of his mouth. Not quite a smile. "I know. I read the incident report." He paused. "All of it." She held his gaze. "We've got a federal medical response authorization," Voss said, "which means I have the authority to bring in additional qualified personnel regardless of local administrative decisions." He looked past her, through the glass, at the controlled disaster she had been managing for the last 40 minutes. "Looks like you've already been running the response." "Someone had to." He nodded once, the way people nod when they are confirming something they already knew. "What do you need?" he asked. Mara thought about the triage board, about Tobias Wynn's pressure readings, about the blast injury patient in Bay 2 and the 3 red tag patients in the queue, and the number of physicians currently standing in the ambulance bay doing the work versus the number standing at workstations looking at screens. "I need 6 people on triage rotation," she said. "I need someone with neurosurgical training on Tobias Wynn in Bay 4. He just came through an emergency decompression and needs continuous monitoring. I need 2 trauma teams capable of independent management so we're not funneling everything through one bottleneck." Voss turned and spoke 2 sentences to the person behind him, who relayed something to the rest of the team, and within 40 seconds the personnel were moving. She watched them go. Then she looked back at the hospital, at the glass panels, at the nurse's station where Brent was standing with his hand over his mouth, at the administrative corridor where she could see Theld, alone, watching the federal medical team walk past him without stopping to ask his permission. He was realizing something. She could see it from here. The particular quality of a person's stillness when the story they have been telling themselves about a situation begins to come apart faster than they can patch it. He had fired her this morning for interfering with his medical authority. And now there were federal personnel in his emergency department, and the woman he had fired had been running the mass casualty response for the last 40 minutes, and a 16-year-old boy was alive in Trauma Bay 4 because of a procedure she had performed with her hands. And the colonel who had just walked into this hospital clearly knew her name before she said it. Mara didn't stay to watch Theld's face complete whatever it was doing. She went back inside. There were still patients who needed her. And that was the only math that mattered. She moved back through the ambulance bay doors with the federal team filtering in behind her, 6 of them peeling off immediately toward triage positions she had already established, 2 heading for the trauma bays, 1 stopping at the central workstation and beginning to interface with the hospital's electronic record system with a familiarity that told her he had done this before, in other overwhelmed hospitals, in other disasters. Voss followed at a measured distance, reading the department the way experienced people read environments, not looking for what was there, but looking for what was wrong. What was wrong, at this particular moment, was the man standing in the administrative corridor. Theld had not moved from the position where Mara had last registered him. I was still there, arms crossed over his chest, watching the federal personnel move through his emergency department with an expression that had shifted from earlier forms of self-certainty into something more complicated. Not quite anger, not quite confusion, but the particular look of a person who is revising their understanding of a situation faster than is comfortable. His eyes tracked Mara as she came through the doors. They tracked Voss behind her. They tracked the personnel who moved without asking anyone's permission, who set up at triage positions and pulled on gloves and began working with the smooth economy of people for whom mass casualty events are a known quantity. Nobody stopped to introduce themselves to him. Nobody checked with him before proceeding. Mara saw him processing this and filed it in the part of her mind that she would deal with later, then went back to Trauma Bay 2, where the blast injury patient, a refinery worker in his 40s, name on the intake sheet listed as Darian Polk, had developed a tension pattern in his left lung that the resident managing him had not caught yet. "Roll the cart back," she said to the resident, whose name tag read Dr. Ellison Farr. "Listen to the left base again." Farr put the stethoscope to the man's chest. She watched his face change. "Decreased," Farr said. "Significantly decreased," Mara said. "His trachea is midline still, so we're not at full tension yet, but that's where this goes if we don't get ahead of it. You need a chest tube on the left side, second intercostal, and you need to do it in the next few minutes." "I've only done 2, Farr said. He said it quietly, not making an excuse, just giving her accurate information. "I know. Walk me through your first 2 steps. Identify the landmark, confirm with percussion. Good, start there. I'll be in the room." She stayed. She did not do it for him. He needed the experience more than he needed rescue. But she stayed close enough that if something went wrong, she could correct it in real time. Farr's hands shook for about the first 30 seconds of setup, then steadied. The procedure took 9 minutes. The patient's oxygen saturation, which had been dropping in increments that had begun to feel inevitable, leveled off and began climbing. Farr exhaled. "Nice," Mara said, and moved on. The department had found a new rhythm in the time since the federal team's arrival. Still intense, still pushing at the edges of capacity, but organized now in a way it hadn't been in the first 30 minutes. The triage flow at the ambulance bay had 3 checkpoints instead of 1. The trauma bays were running parallel tracks instead of sequential. A federal medic named Sergeant Ortega had taken up a position near the central workstation and was coordinating patient distribution with a calm that Brent Calso clearly found both reassuring and slightly humbling, because Brent kept glancing at Ortega the way people glance at someone doing their job better than they did it. The overall picture was still bad. Incoming count had cleared 32 patients. 17 were still in active treatment. 3 had been moved to the ICU. The morgue had received 2, a number that sat in the back of Mara's awareness like a stone she kept stepping around. Tobias Wen was still alive in Bay 4. That was the number she came back to when the weight of everything else accumulated too much. Tobias Wen, 16 years old, who had been somebody's kid going to a summer job that morning, who had been found unresponsive in the smoke 200 meters from the blast center, who would not have survived the 45-minute transport to a neurosurgeon. She checked on him between trauma bays, pausing at the threshold of Bay 4 long enough to read the monitor. Pressure holding, pupils reactively asymmetric but improved from the blown presentation of an hour ago. Oxygen saturation steady. The federal medic assigned to him, a compact woman named Vasquez, was logging observations in a chart that Mara suspected was being transmitted in real time to someone with neurosurgical credentials who was consulting remotely. "Any changes?" Mara asked. "Left pupils down to 2 millimeters, Vasquez said. From 4. Right is tracking at 5. Keep the head of the bed at 30 degrees. If his pressure spikes more than 10 points from baseline, call me." "Copy." Mara turned to go and nearly walked directly into Dr. Yolanda Ferris. Ferris was the administrative director who had stood next to Theld that morning with a tablet and a decision already made. She was still carrying the tablet. She looked different now. Something had gone out of her earlier composure, a kind of careful professional certainty that had apparently not been stress-tested at the MCI level and was showing the strain. "Ms. Calloway." Ferris's voice had shed its earlier formality. What was underneath wasn't warmer exactly, just more direct. "We need to discuss your current status." "I'm aware of my current status," Mara said. "You're on administrative leave. You have been since 7:43 this morning. Everything you've done in this department since then is, there are liability questions that, there's a federal medical response authorization active in this department right now," Mara said. "Colonel Voss can speak to what that covers. That authorization applies to federal personnel. You're a civilian employee on administrative. Dr. Ferris." Mara kept her voice at a level that required Ferris to pay attention, but didn't draw the room. "There are currently 17 patients in active treatment in this department. including a 16-year-old with a traumatic epidural bleed who needed emergency decompression 40 minutes ago and is currently alive because someone performed it. I would be glad to sit down with legal and administrative and HR and whoever else needs to be in the room and go through every decision made in this department today, starting from the medication order in room 7 at 6:58 this morning. I'm available for that conversation. What I'm not able to do right now is stop working. Ferris opened her mouth. Then a monitor alarm fired from Bay 3. A specific alarm pattern that Mara recognized before her conscious mind had time to process the sound, the particular double-tone cascade that indicated a cardiac event, and she was already moving. The patient in Bay 3 was a 58-year-old woman, one of the refinery's administrative staff, who had been brought in with moderate burn injury to her right arm and what had been assessed as a mild inhalation exposure. Her initial presentation hadn't flagged for cardiac risk, but the monitor was showing a wide complex tachycardia that was degrading toward ventricular fibrillation, and the nurse at her bedside, a travel nurse named Pete, who had been working Dunmore General for 3 weeks, was looking at the waveform with the frozen expression of someone who knows enough to be frightened but not enough to know what to do next. "Crash cart," Mara said, already at the bedside, already with her fingers at the woman's wrist and her eyes on the monitor. "Pete, get me the cart and call it out. Someone get Reyes or Farr in here." Pete got the cart. He called it out. His voice cracked on the second word, but he got through it. The woman, her intake sheet said Margaret Tolley, was conscious and frightened, which was useful information because it meant she had a perfusing rhythm still. "I can feel my heart," she said. "It's doing something wrong." "I know," Mara said. "We're going to fix it. I need you to keep talking to me." "My husband doesn't know I'm here." "We'll get him the information. Keep talking." The rhythm was irregular in a way that made the analysis complicated. Mara had seen stress cardiomyopathy in blast and burn cases before, the catecholamine surge that turns the heart against itself. And what she was looking at had that texture. She needed to rule out the medication angle first, which meant knowing what Margaret Tolley had in her system, which meant pulling the medication list from intake, which Pete was already doing because he was frightened but he wasn't paralyzed. Reyes appeared at the Bay threshold. WCTS in a blast patient, possible stress cardiomyopathy versus medication interaction, Mara said, without turning around. "Intake meds." Reyes was already reading. "She's on a calcium channel blocker. Amlodipine, 5 milligrams daily." "What did she get on intake?" Pause. "Ketorolac and 4 milligrams morphine." Mara ran the interaction profile in her head. Not the primary cause of this rhythm, but relevant to how they managed it. No additional calcium channel exposure. Okay. She looked at the waveform. "Get me lidocaine, 1 milligram per kilo, IV push." "Are you—" Reyes stopped herself. She had been about to ask if Mara was authorized to order medications. She decided visibly that this was not the moment for that question. "What's her weight?" "Roughly 60 kilos, 60 milligram push." The lidocaine went in. For 45 seconds, nothing happened, and Mara was already calculating the next step when the rhythm began to organize. The wide complexes narrowing, the rate slowing from its frantic climb, the waveform settling into something that was abnormal but no longer immediately dangerous. Margaret Tolley let out a breath that seemed to deflate something in her entire body. "Is it better?" she asked. "Getting there," Mara said. "You still feeling it?" "Less, still something." "That's okay. Less is what we want right now." She stood at the bedside for 3 more minutes until the rhythm had stabilized enough that she trusted Pete to monitor it. She gave him specific parameters, the numbers that would require immediate re-escalation, and she made him repeat them back, not to embarrass him, but because repetition under stress creates the neural groove that holds when everything else is too loud. When she came back out of Bay 3, Voss was waiting for her in the corridor. He had been moving through the department since arrival, she knew, but this was the first time he'd placed himself specifically in her path. He held a paper cup of coffee that he'd gotten from somewhere, and he offered it to her without comment. She took it. She was cold in a way she hadn't registered until this moment, the kind of cold that comes from sustained output with no intake, and the coffee was terrible, but it was hot. "Ferris filed something upstairs," Voss said, "about your administrative status." "I figured she would." The hospital's legal office is apparently concerned about their exposure if you continue working. What's your concern? She asked. He looked at her for a moment in the particular way he'd always had, not sizing her up exactly because he'd already done that years ago and the results hadn't changed, but checking something internal against what he observed. My concern is that I've got a federal authorization that specifically empowers me to deploy qualified medical personnel in a declared disaster, regardless of local administrative decisions. And I've got documentation on file that speaks to your qualifications more clearly than anything in this hospital's personnel system. She looked at him. What kind of documentation? The kind that's been sitting in a classified personnel file for 5 years, he said. The kind that's going to become somewhat less classified in the next few hours, because I've already requested the declassification process be initiated. The hallway was loud around them, gurneys moving, voices calling out, the ambient noise of a hospital running beyond its limits. Mara was aware of all of it with the portion of her attention not currently occupied by what Voss had just said. I separated quietly, she said. That was deliberate. I know, and I respected that. But you performed an emergency neurosurgical procedure in a civilian ER today, Callaway. That, regardless of the outcome, that's something that's going to require context. The legal and medical board questions are going to come, and when they do, you need more than a nursing license and 9 years of ER experience as your answer. She thought about that. She looked down at the coffee cup. The boy survived, she said. He did. Because of what you did. That's the only part I care about right now. I know that too, Voss said. But there are other people in this building who are going to care about other parts, and they're not going to stop caring just because the patient survived. He was right. She knew he was right because she had spent the better part of the morning not thinking about it, and the not thinking was getting harder to sustain, pressing through the gaps in her concentration at moments like this one, quiet moments that she kept filling back up with the next task. When does the declassification move? She asked. I've got a call in to JAG and to the Army Medical Records Office. Given the circumstances, federal disaster response, active legal questions involving a decorated... He paused, choosing his next word carefully. Involving a veteran with a specific service record, I'm expecting expedited review, probably hours, not days. She handed back the coffee cup, mostly finished. I need to get back. I know, one more thing. She waited. Theld filed an emergency formal complaint with the state medical board, Voss said, about 40 minutes ago, specifically alleging that you performed a surgical procedure outside your licensure in a non-emergency situation. The non-emergency clause was almost elegant in its wrongness, and she might have felt something more acute about it if she hadn't been very tired and very focused on the 12 patients who still needed active management. Non-emergency, she said. That's the language he used. She thought about Tobias Wen's blown pupil. She thought about the ICP curve she'd been watching on the monitor while she worked. She thought about the 45-minute transport window and the timeline of herniation and what Tobias Wen's neurological function would have looked like if she had waited for that window. Okay, she said. That's your response? My response is okay, she said, because the boy survived and the record is the record. Whatever he filed, the clinical documentation exists. The monitor data exists. The timeline exists. She looked at Voss. Does it? Every piece of it. Then that's his problem, she said, not mine, and went back to work. The afternoon wore in the way that disasters wear, not with any dramatic inflection point, but as a kind of relentless accumulation, each hour bringing a slightly different configuration of the same essential pressure. The incoming volume had peaked around 90 minutes after the initial explosion and was now beginning, very slowly, in fits and starts, to level. The red tag cases had been managed or transferred. The yellow tags were being worked through. A field hospital unit from a military base 2 hours east of Dunmore had been mobilized and was en route, which meant the secondary wave of less critical patients would have somewhere to go that wasn't this department. The Room 7 patient, Mr. Garrett, was stable and had not received the original amiodarone dose. His order had been corrected by the covering pharmacist at 9:14 that morning, after Mara had been walked out of the building. She checked his chart while passing through the internal medicine corridor and saw that the corrected dose had been entered by a second physician who had reviewed the same lab values she had reviewed and reached the same conclusion she had reached. She stood in the corridor for a moment looking at that entry. Then she kept moving. It was around 4 in the afternoon when things changed again. And the change came not from the emergency department, but from somewhere Mara hadn't been watching, the administrative wing. Brent found her in the corridor outside Bay 6, where she had been managing a late-presenting inhalation injury in a woman who'd driven herself to the hospital 3 hours after the explosion when her breathing had failed to improve on its own. "The board is convening," Brent said. He was speaking quietly, with the specific energy of someone delivering information that is both important and uncertain in its implications. "Emergency session, something about an outside review of today's events. Ferris went up 20 minutes ago. Theld went up about 10 minutes after her." "Voluntarily?" Mara asked. Brent looked at her. "I don't think so." She considered this. "Who called the session?" "I don't know. Someone said the colonel, Voss, submitted documentation to the board through legal channels about 2 hours ago. And I heard from one of the OR nurses that somebody from the State Health Department's Disaster Response Office was on a call with administration." Mara looked toward the ceiling in the direction of the administrative wing, which was a meaningless gesture but apparently something she did without thinking. "And Theld is up there," she said. "Theld is up there," Brent confirmed. She thought about the emergency complaint Theld had filed with the medical board. She thought about the phrase non-emergency situation and what it would look like against Tobias Wen's admission documentation, his ICP readings, the timestamp on the procedure she'd performed, and the timestamp on the neurosurgeon's grounded helicopter. She thought about a man who had stood in a parking lot this morning watching her walk out of his department and had decided that was the end of it. "Okay," she said, for the second time that day, in reference to the same general situation. She went back to the inhalation patient and finished what she had started. Around 5:30, Voss came to find her again. This time he had a different quality to his presence. Not the measured check-in of a few hours ago, but something with more weight to it. The way people carry themselves when the information they're bringing is the kind that changes things. "The board session ended 20 minutes ago," he said. "And?" "Theld left early. I'm told it wasn't voluntary." She waited. "The pharmacy director presented the room's 7 medication timeline," Voss said. "The flagging documentation you entered at 7:18, the clinical rationale, the corrected order. He walked the board through what the outcome would have been if the original order had been dispensed." Mara said nothing. "The security office also submitted their logs for this morning. Timestamps for your exit, timestamps for the explosion, timestamps for first patient arrival." Voss paused. "And timestamps for Dr. Theld's badge activity after the MCI was declared." Something went quiet in Mara's chest in a way that was not satisfaction exactly, but was adjacent to it. "Where did his badge show?" she asked. "Administrative wing," Voss said. "Logged in the administrative elevator at 8:04. The first mass casualty patients arrived at 8:11. He paused again, deliberate. "He did not badge back into the clinical area until 9:47. 9:47. She did the math. The first wave of patients had been triaged, sorted, and the most critical among them treated and stabilized in the window between 8:11 and 9:47. Tobias Wen's procedure had been completed by 9:03. Darian Polk's chest tube had been placed by 8:50. Margaret Tolley's cardiac event had been managed at 9:21. All of it, every piece of it, in the window when the head of emergency medicine had been logged in a different part of the building. "He's going to say he was coordinating the administrative response," Mara said. "It wasn't a defense of him. It was just the shape of what was coming." "He's welcome to say that," Voss replied. "The board has the security footage as well." She looked at the floor for a moment, not because she felt anything in particular about it, or not only that, but because the weight of the day was pressing on her in a way she hadn't let herself feel until now. And letting herself feel it for a few seconds seemed like something she needed to do before she could continue. Tobias Wen's monitor was still pinging steadily in Bay 4. That was still the number she came back to. "What happens now?" she said. "The board has suspended his clinical privileges pending a full investigation," Voss said. "The State Health Department Disaster Review is going to pull everything: clinical records, security footage, administrative communications, pharmacy logs, and the medical board complaint he filed against you has been formally noted." He met her eyes. "But the board is also in receipt of my documentation regarding your service record and qualifications. I submitted it 2 hours ago. They've requested the full record as part of the administrative review." She straightened up. She was aware of being tired in a bone-level way that she would not feel properly until she stopped moving, which was not yet. Vasquez is still on Tobias when? She asked. Yes. I want to check in before I do anything else. She walked back toward Bay 4, and Voss fell into step beside her, and as they moved through the corridor, she became aware that the department had shifted around her again. The federal team integrating so completely with the remaining hospital staff that the seams were barely visible anymore. Ortega and Reyes working in a kind of shorthand that had developed in the last 6 hours of shared crisis. Pete moving through the triage area with a confidence that hadn't been in him at noon. Brent at the central station running a department that was still overwhelmed but was no longer breaking. She pushed open the door of Bay 4. Tobias Wen was awake. It was not dramatic, not a movie kind of awake, with the eyes opening on cue and the first breath landing like punctuation. He had apparently been drifting in and out for the last 20 minutes, Vasquez told her, cycling through states of orientation with the unpredictable quality of a brain that had been through significant trauma and was figuring out its own recovery timeline. But he was awake now, his eyes tracking the ceiling, and when Mara moved into his line of sight, he turned to look at her. His face was young in the way that 16-year-old faces are young, the bone structure not yet fully set, the expressions not yet calibrated for concealment. He looked at her with the confused directness of someone who doesn't know what they missed. "Hey," he said. His voice was rough from the intubation. "Hey," Mara said. She pulled the small light from her pocket and checked his pupils. Left at 2 millimeters, tracking, right at 4, tracking. Both reactive. "How's your head?" "Bad," he said. "That's accurate. It's going to be bad for a while." He looked at her for a moment. "What happened?" "There was an accident at a facility near where you were working," she said. "You got hurt. You're in the hospital now." "Am I—" He stopped. Swallowed. "Is it bad?" She considered how to answer that, because honesty mattered, and so did not terrifying a 16-year-old who had just come back from the edge of something he didn't know he'd been on the edge of. "You had a serious brain injury," she said. "You needed emergency care that we gave you here. Your vitals are improving, and that's a very good sign." He was quiet for a moment. "My mom," he said. "We're going to contact her," Mara said. "That's the next thing." He closed his eyes. She thought he might be drifting again, but then he said, "Thank you," very quietly, to the ceiling, or to no one in particular, in the unself-conscious way of someone who hasn't yet relearned how to be guarded. Mara stood at the threshold of the bay for a moment after that, not quite in and not quite out. Behind her, somewhere in the corridor, she could hear voices, Voss's and Ferris's, and one she didn't recognize that had the particular cadence of someone reading from official documentation. The weight of whatever was happening in the administrative review was pressing through the walls of the hospital, the way the smoke from the refinery was still pressing at the windows, thin but persistent. She was aware, because she was honest with herself in a way she hadn't always been, that the next days were going to be complicated, that the medical board complaint existed regardless of its merit, that the investigation into Theld's conduct would require her testimony, that the declassification process Voss had initiated would surface things about her history that she had kept quiet for 5 years, and that having those things surface in this context, in a disciplinary proceeding, in the middle of a disaster record, was not the way she would have chosen. But Tobias Wen was awake and thanking the ceiling, and the room 7 patient had not received a lethal dose of the wrong medication, and 17 people who had come through those ambulance bay doors in the first terrible hour of the day were still alive because somebody had stood at that door and sorted them with the right hands and the right knowledge. She turned away from Bay 4 and walked back into the corridor, and she was still walking, still moving toward the next thing, the next patient, the next decision. When the door to the administrative stairwell opened, and 2 people in civilian suits she didn't recognize came through it, moving with the specific purposeful speed of people who have been told something needs to happen immediately. They were carrying documents. They were heading for Theld's office. And from somewhere above her, from the administrative floor where the board session had apparently not entirely ended, she heard a raised voice, Theld's voice, unmistakably, carrying even through the walls and the floor, and then a second voice, measured and official, that she didn't recognize at all, and then the sound of a door closing, and then silence. The silence from the administrative floor lasted exactly 4 minutes. Mara knew because she was watching the clock above the central workstation. Not deliberately, not because the time mattered clinically, but because her brain was doing the thing it did under sustained stress, cataloging ambient details with a precision that served no immediate purpose. 4 minutes, and then the stairwell door opened again, and one of the suited figures came back through it, moving faster than before, and crossed the corridor to where Voss was standing near the triage station. The conversation lasted about 45 seconds. Mara didn't hear it. She didn't try to. She was checking on a burn patient in Bay 6, a woman in her late 30s named Sandra Pruitt, refinery administrative staff, second-degree burns to both forearms from a steam release she'd been standing too close to when the primary explosion triggered secondary failures down the line. Sandra had been stable for 2 hours and was now in that particular post-crisis state where the adrenaline had fully metabolized, and what remained was pain and the slow, frightening recognition that something had actually happened to her body. "It's going to look worse before it looks better," Mara told her, because Sandra had been staring at her wrapped forearms with an expression that was heading somewhere counterproductive. "The blistering is normal. The fluid accumulation under the dressing is normal. None of that means it's getting worse." "It feels like it's getting worse," Sandra said. "It hurts more now than it did an hour ago." "A lot more." "That's also normal. When your system comes down from the shock response, the pain signal gets louder. Doesn't mean the injury changed." Mara adjusted the dressing check on the left forearm, which was the worse of the two. "The morphine we gave you is still working. You just feel it more because the other thing that was blocking it stopped." Sandra looked at her. "What other thing?" "Your body's emergency response. It's very good at suppression when it thinks you need to keep functioning. When it decides you're safe enough to stop, it lets the pain through." She straightened up. "Which is uncomfortable, but is actually a sign you're stabilizing." Sandra considered this for a moment. "That seems like a design flaw." "It's got a few," Mara agreed. She was at the bay threshold when Sandra said, "Are you the one who's been running things out there?" Mara paused. "Different people have been running different things," she said. "Pete told me, the travel nurse." Sandra shifted slightly against the pillow. "He said the hospital fired you this morning, before all of this started." Mara didn't answer immediately. "He said you came back anyway." "There were patients," Mara said, and left it at that, and went back to the corridor. Voss was waiting for her. The suited figure was gone. "JAG-E cleared the preliminary declassification," he said. "Your service record is going to be accessible to the board and to the State Health Department's Disaster Review Committee within the hour. Full record. Deployments, commendations, the trauma specialist certification, the field surgical qualification." He paused. "Everything." She had known this was coming. She had known it since the parking lot, since the moment she had looked through the glass doors and seen Voss come to attention. But knowing a thing is coming and standing in the corridor of a hospital you were fired from this morning while your classified military record gets processed into a board proceeding are two different experiences, and she let herself feel the gap between them for about 3 seconds before she filed it. "How much of it?" she asked. "The non-operational portions, the service history, the qualifications, the commendations. The specific mission records stay classified, deployment locations, operational details. But the credentialing, your trauma certification, the field surgical training, the emergency medicine equivalency the Army credentialed you for in year 3, all of that becomes accessible. And the board can use that to contextualize the procedure on Tobias Wen. That's the intent." She thought about the word equivalency. The Army had a system, a rigorous, documented, tested system for qualifying combat medics in advanced procedures that had no clean civilian analog. She had gone through that system. She had been evaluated against it. The piece of paper it produced was not a medical license, but it was also not nothing, and in the context of a declared disaster with no available neurosurgical resources. In the context of a patient with a 14-minute herniation window, the distinction between what she was licensed to do and what she was qualified to do had collapsed into a single operational question. Could she do it, and would she? She had answered both parts. "The formal complaint they'd filed," she said. "The non-emergency language. Does the board have the timeline documentation to address that? They have the paramedic intake report, the GCS scores on admission, the ICP indicators you documented before the procedure, and Vasquez's ongoing monitoring record." Voss met her eyes. "They also have the helicopter grounding logs from the Regional Aviation Authority. Official timestamps on when neurosurgical transport became unavailable, and when it would have become available again. 45 minutes, she said, 47 by the official log. She thought about a brain under pressure. She thought about the specific cascade of herniation, the timeline she had learned in a field hospital outside of a city she was not supposed to name, taught by a surgeon who had seen it more times than anyone should have to see it. Untreated arterial epidural hematoma in a teenager, 6 to 8 minutes of clinical window after the first herniation signs before the damage became irreversible. 47 minutes of unavailable transport. The math was not subtle. Okay, she said, for what felt like the third time that day in reference to situations that were beyond her immediate control. What do you need from me? A written statement, formal, for the board record. Clinical rationale, procedural timeline, outcome data. He paused. Tonight, if possible. After I finish rounds. He nodded. He started to say something else and then didn't, which meant there was something else. And she looked at him until he said it. Theld's attorney contacted the board office 20 minutes ago, Voss said. Filed an emergency injunction request to delay the board's review of his clinical privileges pending independent investigation of your conduct. She absorbed this. He's trying to make this bilateral, she said. He's trying to reframe the narrative, Voss said. Position the board's focus on your unauthorized procedure rather than his conduct during the MCI response. She thought about the security badge logs. Theld's timestamp in the administrative elevator at 8:04. The first patients through the ambulance doors at 8:11. The 96-minute gap before he had badged back into the clinical area. Does his attorney have the security footage, she asked. Not yet. When they get it, the injunction becomes significantly harder to sustain, Voss said. Yes. She looked down the corridor toward Bay 4, where Tobias Wen was awake and oriented and had thanked the ceiling in the hoarse voice of someone who had come back from a place he didn't know he'd been. I'll write the statement tonight, she said. She went back to work. The next 2 hours were different from the first wave. The acute pressure had eased enough that what remained was the harder, less dramatic labor of sustained care, the management of complications in patients who had been stabilized but not resolved, the close watching of indicators that could shift without warning. Mara moved through it with the kind of focus that didn't require adrenaline, the quieter form of attention that in some ways demanded more. Paloma Reyes found her at 7:15 in the corridor between Bay 8 and the nursing station, with an expression that was several things at once, exhausted and unsettled, and something underneath that Mara took a moment to read. Can I ask you something? Reyes said. Go. The procedure on Tobias Wen. Reyes had her arms crossed, not defensively, more like she was holding something in. I've been thinking about it all afternoon. The technique you used, the lateral approach, the sequential decompression, the way you managed the arterial bleed through a field-adapted instrument setup. She paused. That's not in any civilian training program I've seen. The specific sequencing of it. Mara looked at her. No, she said. It's not. Where did you learn it? It was a direct question from a direct person, and it deserved a direct answer, even though the direct answer was one Mara had not given in this building, or in any building in Dunmore, in 9 years. I was a combat trauma medic for 4 years before I went into nursing, she said. Specialized unit. 3 deployments. The field surgical training was part of the credentialing program the Army ran for our team. Reyes stared at her. Why did you... She stopped. Started again. Why didn't anyone know that? Because I didn't tell anyone. Why? Mara thought about how to answer this in a way that was honest without being more than Reyes needed. Because I wanted a different life, she said. Not a better one. Just different. And because in my experience, when people know you can do something extraordinary, they start expecting you to do it, and then they stop learning to do it themselves. She looked at Reyes steadily. You placed 2 chest tubes today, independently. Did you know you could do that before today? Reyes was quiet for a moment. I wasn't sure, she said. Now you are. That happened because I didn't step in and take over. You needed to find out. Mara tilted her head slightly toward the department. There are 32 patients in this building right now who got through today because multiple people found out what they could do. That doesn't happen if everyone is deferring to the one person who can do everything. Reyes looked at her for a long moment with the expression of someone filing something important. Thank you, she said. For today. For all of it. Mara nodded once. Get some rest when you can. At 8:47, the board chair came down from the administrative floor. His name was Dr. Philip Gaunt, a 60-year-old internist who served as chair of Dunmore General's Medical Executive Committee and had, in Mara's 9 years of employment, been a mostly invisible administrative presence. Someone she knew by name and reputation and the occasional all-staff memo, but had never had a direct conversation with. He was a tall man, thin in the way of people who forget to eat when they're thinking about other things. And he came into the emergency department with the slightly disoriented air of someone who spends most of his working hours in meeting rooms and finds the clinical environment newly confronting. He found Mara at the nursing station. Ms. Calloway. He didn't extend his hand, which told her something about how he was reading the situation. I'm Philip Gaunt, board chair. I know who you are, she said. I want to apologize on behalf of the board for the conditions under which you were placed on leave this morning. He said it carefully, with the slightly formal quality of someone who is aware that what they're saying will eventually appear in a document. The complaint process was not followed correctly, and the circumstances, the patient safety concern you raised, the nature of the medication order, those required more thorough review before any administrative action was taken. She looked at him. Mr. Garrett in room 7 is stable, she said. I'm aware. The pharmacy director briefed the board fully. He cleared his throat. I also want you to know that the board has voted to suspend Dr. Theld's clinical privileges pending a complete investigation into his conduct during today's mass casualty response. That decision was unanimous. She held his gaze and did not say anything. Colonel Voss has provided documentation regarding your service record and qualifications, Gaunt continued. The board has reviewed the preliminary materials. We're requesting the full declassified record, and we've also requested an expedited consultation with the State Medical Board regarding the procedural questions around Mr. Wynn's treatment. He paused. Based on what we've seen so far, the board's position is that the procedure you performed was clinically justified given the documented emergency conditions and your demonstrated qualifications. That's not the position taken in the complaint Dr. Theld filed, she said. Dr. Theld's complaint is being reviewed, Gaunt said carefully, in light of additional information that has come to the board's attention since it was filed. The additional information, she knew, was the security footage. She knew it from the specific way Gaunt said it, not looking at her when he did, choosing words that could hold a lot of weight without identifying what that weight was. I'll provide a full written statement tonight, she said. Clinical rationale, procedural timeline, outcome documentation. Colonel Voss requested the same. Thank you. He nodded once, formally. The board also wants to make clear that your employment status, Dr. Gaunt. She kept her voice even. I appreciate what you're telling me. I do. But I've been on shift for 13 hours. I have patients I need to check on, and I'd like to finish this conversation after I've done that. Can we schedule something for tomorrow morning? He looked slightly surprised, which she found mildly interesting. Of course, he said. He went back to the administrative floor. Mara turned back to the board and found Brent standing 2 feet away with an expression she couldn't fully classify. Did he just apologize to you? Brent said. Close enough, she said. I've worked here 11 years, Brent said. I have never seen Gaunt come down to the floor. Long day, she said, and meant it to cover more than just the observation. She went to check on Tobias Wen. He was more alert than before, sitting up slightly, which Vasquez had allowed given his pressure stability, watching the door with the particular hyper-awareness of a teenager in an unfamiliar place who has been told something bad happened to him but hasn't fully integrated it yet. His mother was there now, a small woman in a gray jacket who had arrived 40 minutes ago and was sitting in the chair next to the bed with her hand over her son's hand in the way that parents sit when they are holding themselves together through the force of not letting go. She looked up when Mara came in. You're the nurse who... She stopped. They told me you were the one who helped him. A lot of people helped him, Mara said. I was one of them. The woman's mouth did something that wasn't quite crying but was close to it, and then she pressed it back. Thank you, she said. I don't know what else. You don't need anything else, Mara said. She checked Tobias's pupils, both tracking now, reactivity good, pressure holding at a range she was satisfied with. She looked at his face. He was watching her with the same direct quality as before, minus the ceiling thank and the hoarseness, which meant he was getting his bearings back. Still bad? She asked. Still bad, he confirmed. But like, Differently bad. Differently bad is good. Differently bad means your brain is recalibrating. She made a note in the chart. Dr. Felsner is going to do a proper consultation tomorrow morning. He's the neurosurgeon who should have been here today and wasn't, through no fault of his own, and he's going to want to do imaging and a full assessment. Is that bad? Tobias asked. It's thorough, she said, which is what you need right now. She left him with his mother and went to write the statement. She used a terminal in the small office behind the nursing station, a room that existed primarily to hold supply requisition forms, and the occasionally abandoned lunch, not large enough for more than one chair and a desk. And she wrote for 40 minutes without stopping, in the direct and specific language she had learned to use in environments where imprecision could end lives. Clinical findings on admission, GCS score and trajectory, pupillary response, Cushing's triad presentation, the ICP indicators that established herniation timing, the neurosurgical transport unavailability, and the documented window. The procedural steps, in order, with the instrument adaptations noted and the rationale for each. The outcome data, pressure normalization, pupillary recovery, current status. She included the contact reference she had called, the letter R, and the institutional affiliation she was now able to disclose, which was a military medical consulting unit that operated within a structure that Voss's team had already partially documented for the board. She did not editorialize. She did not defend herself. She presented the record as it existed and let the record be what it was. At 10:14, she sent the document to Voss's secure contact and to the board's administrative address. Then she sat in the chair for 4 minutes and looked at the wall. She was very tired. Not the acute tiredness of sleep deprivation, but the deeper kind that comes from sustained engagement at high intensity, the kind that settles into the connective tissue and the spaces behind the eyes. She had eaten a granola bar at some point in the afternoon. She couldn't remember exactly when. And the coffee Voss had given her, and nothing else since the banana she'd had in the car at 6:30 that morning on the way to a shift she had expected to be ordinary. She had expected this morning to be ordinary. She sat with that for a moment. The thing about ordinary was that it was what she had chosen. She had come back from 3 deployments and a service record she was proud of, and a version of herself she had needed to set down because carrying it into civilian life had not been working, and she had built ordinary deliberately and with care. The nursing license, the 9 years, the apartment 12 minutes from the hospital with the 3 plants she kept alive, and the running route along the eastern edge of Dunmore that she did on weekend mornings when the industrial smoke wasn't too bad. She had built a life that fit inside a set of hours she understood. This day had not fit inside those hours. She was not sure, sitting in the supply office at 10:14 on an October night, what her life looked like on the other side of this day. She got up. She had 2 more patients to check before she could leave. At 10:50, she was in the corridor outside Bay 11 when her phone buzzed. The contact listed on the incoming call was not R. It was a number she didn't have saved, with a Colorado area code, and she almost didn't answer it, and then did. Ms. Calloway. The voice was male, formal, and completely unknown to her. My name is Reginald Foss. I'm the regional director for the Colorado State Medical Licensing Board. She stopped walking. I'm aware this is an unusual hour, Foss said. I'll be direct. The board has been in emergency session since 6 p.m., reviewing the documentation submitted by Dunmore General's Medical Executive Committee, the material provided by Colonel Voss's office, and the formal complaint filed by Dr. Marcus Theld. I submitted a written statement earlier this evening, she said. Did the board receive it? We did. It was useful. A pause. Ms. Calloway, I'm calling to inform you that the board has voted to provisionally dismiss the complaint filed by Dr. Theld pending the completion of the formal disaster review. The language regarding non-emergency circumstances has been specifically noted in the board's record as factually unsupported by the clinical documentation. Another pause. Smaller. The board's position is that the clinical record establishes a clear emergency condition and that your response was medically appropriate given the circumstances and qualifications presented. She leaned against the corridor wall. Additionally, Foss said, the board is initiating a separate formal inquiry into Dr. Theld's conduct, specifically the complaint that was filed. There are questions about whether the complaint was filed in good faith given the clinical record. He cleared his throat. I want to be clear that this inquiry is independent of the disaster review process. She understood what he was telling. Filing a false or bad faith complaint with the state medical board was itself a licensure violation. They were not just reviewing Theld's clinical conduct, they were reviewing the complaint he had used as a weapon. "Thank you for calling," she said. "Of course." A pause. "One more thing, Ms. Calloway. The board has been asked by Colonel Voss's office to consider an expedited pathway for recognition of your military medical qualifications under the state's Veteran Healthcare Provider Licensing Statute. It's a relatively new statute, not widely used, but given your documented qualifications, you may be eligible for a licensed independent practitioner designation that goes considerably beyond your current nursing licensure." He said it carefully, like he was reading from a draft. "The board is not in a position to formally recommend that pathway tonight, but I wanted you to be aware it exists." She looked at the ceiling. The corridor lights were fluorescent and slightly too bright and had been buzzing at the same pitch for the entire 14 hours she had been in this building, and she had stopped noticing the buzz around hour 3. She noticed it now. "I appreciate you telling me," she said. She hung up. She stood in the corridor for a moment. Through the wall, she could hear the sounds of Bay 11, a monitor, a quiet exchange between a patient and a nurse, the particular ambient texture of a room where someone was stable and resting. She could hear the nursing station 30 feet away, Brent handing off to the night charge, the transfer of information that marked the end of a shift. She could hear, if she listened with the right kind of attention, the specific quiet of a department that had been through something and was still standing. Her phone buzzed again. Not a call this time. A text from Voss. "Board session wrapped. Full disaster review scheduled for next week. Theld's counsel withdrew the injunction request 2 hours ago. Security footage was provided to both parties. Thought you should know tonight." She read it twice. The injunction withdrawn. The footage seen. Whatever Theld had constructed in the hours since he filed that complaint, whatever version of this day he had been building in the administrative wing while she worked the department below, had come into contact with the security footage and had not survived the meeting. She put the phone in her pocket. She went to check on her last 2 patients. The first was Darian Polk, the refinery worker whose chest tube Farr had placed. Stable, oxygen saturation holding at 96, breathing with an effort that was still visible but manageable. Polk was asleep. She checked the drain output, adjusted the collection position, noted the numbers, and left without waking him. The second was Margaret Tolley, the cardiac patient, who was awake and watching the door when Mara came in, as if she had been expecting someone. "I heard they fired you this morning," Margaret said. Mara looked at her. "Word travels. Hospital," Margaret said, as if this explained everything, which it did. "My cousin is a floor nurse here. She texted me at 8:30 this morning and then didn't text again for 4 hours, which was apparently because things were insane, which I gather is an understatement." "A moderate one," Mara said. She checked Margaret's rhythm on the monitor. Normal sinus, rate in the low 70s, a world away from the deteriorating waveform of 6 hours ago. "How are you feeling?" "Like someone turned my heart inside out and then put it back mostly right." Margaret looked at her hands. The right one, unbandaged, was resting on the blanket. "Is it mostly right?" "Your rhythm has been stable for 5 hours," Mara said. "The cardiology consult tomorrow will give you a clearer picture, but yes, mostly right." Margaret was quiet for a moment. "The man who fired you," she said. "Is he still here?" Mara paused in the act of making a note. "His clinical privileges have been suspended pending investigation," she said. "That's not what I asked." She looked at Margaret. "I don't know where he is right now," she said honestly. "My cousin says he was escorted to his office by 2 people in suits about 4 hours ago," Margaret said. "She said he came out looking like someone had taken something away from him." Mara closed the chart. "Get some rest," she said. "The cardiology team will be here early." She was in the corridor, coat on, bag over her shoulder, nearly at the ambulance bay doors when Brent caught up with her. "Hey," he said. She stopped. He looked like someone who had been awake for 18 hours, which he had, and who had just managed a mass casualty event he had never trained for at the level it had required, which he also had, and who was standing in the aftermath of that experience with no clear framework for what the next thing was supposed to be. "I should have," he started, and then stopped. She waited. "When Ferris told you, when they put you on leave, I should have said something. Brent, I'm serious. I've known you for 9 years and I stood there. You ran this department today, she said. When it mattered, you made the call. 3 seconds. She held his eyes. That's not nothing. He looked at the floor. You came back. You didn't have to come back. Yes, I did, she said. And it was not a heroic thing when she said it, just accurate. So did you. She pushed through the ambulance bay doors. The October night was cold and clear, the smoke from the refinery finally thinning enough that she could see the lower stars above the eastern horizon. The parking lot was still partially occupied by the 3 black SUVs, 2 of them dark now, one still running with a figure visible in the driver's seat. The emergency lights on the ambulance bays had shifted from the frantic strobe of the afternoon to the quieter amber of standard operating mode. She stood in the parking lot. She was thinking about what Foss had said, the licensing statute, the independent practitioner pathway, the words considerably beyond your current nursing licensure offered into a phone conversation at 10:50 on a Monday night, like a door someone had propped open and left for her to decide about. She was thinking about what that decision looked like. She was thinking about Tobias Wynn's pupils tracking, about Darian Polk breathing at 96%, about Paloma Reyes placing a chest tube with shaking hands that had steadied, about Margaret Tolley's heart finding its rhythm again. She was still standing there when the hospital's main entrance lights flickered. Not a flicker, exactly. More of a shift. The lights in the lobby going from their standard evening level to something brighter, more activated, in the specific way hospital entrance lights activate when something is happening in the entrance that requires attention. She turned to look. Through the glass, she could see people moving in the lobby. Not the controlled movement of clinical staff, but the different quality of administrative personnel and suited individuals converging, moving with purpose, toward the administrative elevator bank. And there, visible through the lobby glass at 200 feet's distance, was Dr. Marcus Theld. He was not wearing his white coat. He was in street clothes, and he was carrying a bag, and he was moving toward the main exit with 2 individuals beside him. Not security, not medical staff, but the kind of official-looking people who appear at the end of processes rather than the beginning. He reached the main exit. The automatic doors opened. He stepped out into the parking lot, and he looked up from where he was walking, and across 200 feet of October night, his eyes landed on Mara. She did not move. He looked at her for a moment with an expression she had not seen on him before. Not the dismissive authority of the morning, not the controlled anger of the medical board complaint period, but something stripped down to a rawness that she hadn't expected on his particular face. A look that might have been many things but was most legible, at its core, as the look of a person who has begun to understand the full dimensions of what they've done. Then the people beside him said something, and he looked away, and they walked him to a vehicle she didn't recognize that was idling near the main entrance. The vehicle pulled out. And in the window of the hospital above her, the administrative floor, the boardroom where the emergency session had run for 6 hours, a light went on. Not the light of an ending, the light of something that had just begun. Her phone buzzed. Unknown number, Colorado area code, different from Foss's. She answered it without thinking, already reading the parking lot. Ms. Calloway. Female voice, measured, authoritative, the particular cadence of someone who makes important phone calls at unusual hours as a matter of professional routine. My name is Audrey Winslow. I'm the Deputy Inspector General for the Colorado Department of Health's Hospital Oversight Division. A brief pause. I understand today was an extremely difficult day. I apologize for the hour. I need to ask if you'd be available for a formal interview tomorrow morning regarding the events at Dunmore General Hospital, beginning with a medication safety incident at approximately 7 a.m. and extending through the mass casualty response. Mara looked at the administrative floor window. Yes, she said. I'm available. Thank you. The woman paused again, and then said something that the formal part of the call had not left space for, something that arrived in a different register entirely. Ms. Calloway, I've read the clinical timeline documents submitted this evening, all of them. A beat. I'll see you tomorrow. The call ended. Mara stood in the parking lot with the phone in her hand. Somewhere above her, in the administrative wing, the light in the boardroom window went out. And then a different light came on, brighter, in a different part of the floor, in a room she didn't recognize from this angle. She stared at it. And then her phone buzzed a third time, and it was not a call. It was an alert from the hospital's internal communication system, forwarded to her personal number because she was still, despite everything, still in the system, flagged as active clinical staff. She opened it. It was a patient status notification. Bay 4. Tobias Wen. Her stomach dropped. She was already moving when she registered what the notification actually said. Not a deterioration alert, not a pressure spike, not the numbers she had been monitoring for signs of a bleed recurrence. It was a nursing note, filed by Vasquez at 11:03 p.m., patient alert and conversational, requesting to speak with the nurse who performed his procedure. States he has a question, non-urgent. She stopped walking. She stood in the parking lot for a moment with the cold air on her face and the hospital lights above her and the October stars coming through the thinning smoke and the notification on her screen. A 16-year-old boy, awake and wanting to ask her a question. She went back inside. Tobias Wen's question was not what she expected. She had walked back through the ambulance bay doors and down the corridor to Bay 4 with the specific mental preparation of someone who has been asked to explain a complicated thing to a person who is not yet equipped for the full version of it, thinking about how to describe what had happened to his brain in terms that were honest without being frightening, how to address the what could have happened without making it the center of the conversation, how to answer the questions a 16-year-old asks after surviving something he didn't know he was surviving. She pushed open the bay door. His mother was asleep in the chair, head tilted against the wall, the gray jacket pulled up over her shoulders like a blanket. Tobias was awake, the bed angled at 30 degrees, his eyes moving to Mara when she came in with the alert quality of someone who had been thinking about a thing and was ready to say it. She pulled the rolling stool from the corner and sat down so she wasn't standing over him. Vasquez said you had a question. Yeah. He was quiet for a moment, looking at the monitor above his bed. Did it hurt? When you did it. The thing you did to my head. She looked at him. You were unconscious, she said. You didn't feel anything. I know, I meant, did it hurt you to do it? She sat with that for a moment. No, she said carefully. It didn't hurt me. But it was hard. Yes. He nodded, processing this with the particular seriousness of a teenager who has decided to take something seriously. I wanted to know if it was bad, what you had to do. Why does that matter to you? He looked at her. His eyes were clearer now than they'd been all day, the confusion of the earlier hours resolving into something more focused, and she could see that the question was not casual. He had been lying in this bed thinking about the fact that someone had done something difficult and possibly distressing on his behalf, while he was unconscious and unable to know it or consent to it or thank anyone for it in the moment. Because if it was bad, he said, I want to know, so I'm not just walking around not knowing what someone did for me. She looked at the monitor for a moment, his pressure, his rhythm, his oxygen saturation, all of it holding at numbers she was satisfied with. It was hard, she said again, and I would do it again, without hesitation. He nodded slowly. Okay, he said. Thank you. Get some rest, she said. Dr. Felsner comes early. She left him and his sleeping mother and went home for the first time in 17 hours. She did not sleep well. This was not surprising. She lay in her apartment in the specific alertness of a nervous system that had been operating at high intensity for an extended period and had not yet received the message that the intensity was over. And she stared at the ceiling and thought about the licensing statute Foss had mentioned, and about the Deputy Inspector General's interview in the morning, and about the particular expression on Theld's face in the parking lot, that stripped-down rawness she hadn't been prepared for. And she turned that last one over a few times before she decided she was done looking at it and made herself think about something else. She thought about the Littmann stethoscope she had left on the break room counter. She hoped someone had put it somewhere safe. She was at the hospital at 7:15, which was earlier than the 8:30 interview time Winslow had specified, because she wanted to check her patients before anything else took over the morning. The department was in the quieter post-crisis mode of a Tuesday, lower volume, the night shift handing off to day shift, with the slightly gray-faced quality of people who had worked through something large and were now on the other side of it. Brent had left a detailed handoff note that was 3 pages long, which told her everything she needed to know about how seriously he'd taken the overnight. Tobias Wen's overnight was stable. His neurology readings had held through the night with no spikes, and Dr. Felsner, who had driven in rather than flying because the smoke advisories were still partially active over the region, had arrived at 6:40 and was already in Bay 4 when Mara checked in, standing at the bedside with a tablet and the focused expression of a surgeon reviewing a case that had been managed without him and finding that it had been managed correctly. He looked up when she came in. He was 50-ish, compact, with the kind of face that didn't perform. No performed warmth, no performed authority, just direct attention. He looked at her for a moment. "Dr. Felsner," she said. "Ms. Calloway." He looked back at the tablet. "The sequential decompression approach. Lateral entry at the pterion, controlled aspiration before full burr extension." "Yes." "That's a military field adaptation. I've seen it in literature from forward surgical teams." "I was a forward surgical team," she said. He looked up again. A pause that lasted about 2 seconds. "The outcome is consistent with early intervention at the right anatomical site. His ventricle isn't compressed, and the midline shift on this morning's portable is less than 2 millimeters. You bought him the imaging window he needed. That was the goal. I'm recommending formal neurosurgical follow-up every 48 hours for 2 weeks, then MRI at 30 days. He looked at Tobias, who was watching both of them with the attentive expression of someone tracking a conversation in a language they mostly understand. "He's going to be fine." He said it to the room, not to either of them specifically, and the weight of those 4 words landed in the bay with the quiet force of a thing that has been uncertain for 24 hours and is now not. Tobias's mother, who had apparently been awake and listening from her chair for the last several minutes, made a sound that she covered with her hand. Mara left them and went to check on the others. Darian Polk was sitting up, eating hospital breakfast with the appetite of a man who had come within range of a catastrophic pulmonary event and had emerged on the other side with a renewed relationship with scrambled eggs. The drain output was within acceptable range. His saturation was 97% on room air. He told her his wife was coming at 9, and he was hoping to be moved to a regular room by afternoon. "That's possible," she said. "Depends on the chest tube output over the next few hours." "I heard what happened," he said. "Yesterday. The whole thing." He was looking at her with a direct quality that wasn't uncomfortable, just frank. "I heard you were fired right before it started." "That's accurate." "And you came back?" "Yes." He was quiet for a moment. "Why?" She thought about Tobias Wen's version of this question, and Sandra Pruitt's version, and Brent's version, and the various ways she had answered it throughout the previous 18 hours, all of which were true and none of which felt complete. "Because the alternative was sitting in a parking lot," she said. He laughed, a short, unprepared sound that pulled at his chest and made him wince. "Fair enough," he said, and she left him to his eggs. The Deputy Inspector General's interview was held in the hospital's main conference room on the 3rd floor, a room Mara had been in once before for a mandatory policy update 3 years ago, and which had the particular anonymous quality of rooms that exist primarily for institutional functions. Audrey Winslow was already there when Mara arrived, seated at the head of the table with 2 staff members flanking her and a recording device in the center of the table that Winslow identified and explained before anything else happened. Winslow was a woman in her mid-50s, sharp-featured, with the particular efficiency of someone who manages large amounts of complex information for a living and has learned to move through it without losing the thread. She had a copy of Mara's written statement and a copy of the clinical timeline documents and a copy, which Mara noted with interest, of the pharmacist's documentation regarding the Room 7 medication order, which meant Winslow's office had been doing its own document collection in parallel with the board's processes. "Let's start from the beginning," Winslow said. "The medication order. Walk me through what you observed, what you did, and the response you received." Mara walked her through it. She was precise and chronological, and when Winslow asked questions, they were specific and good, the kind of questions that indicated the person asking had already read the documentation thoroughly and was looking for the texture of the experience, rather than the factual summary. She asked about Theld's tone. She asked about the witnesses. She asked whether Mara had considered escalating to a supervisor rather than the attending directly, and Mara said yes, and explained that in her assessment the time-sensitive nature of the order made direct escalation the appropriate first step, and Winslow noted this without comment. They went through the MCI response. Winslow had the triage documentation, the patient intake logs, the timestamp records, and she moved through them with the systematic care of someone building a structural record. She asked about the federal team's arrival and the authorization framework. She asked about the coordination between Mara and Colonel Voss. She asked about Dr. Theld's whereabouts and activities during the MCI response, and Mara answered that question the same way she had answered all the others, with what she had observed, what the timestamp showed, and what she could not confirm from personal observation. She did not editorialize. She did not characterize. She gave Winslow the record as she had lived it and let Winslow's office do the work of interpretation that was their job to do. The Tobias Wen procedure took 45 minutes of the interview. Winslow asked every question there was to ask about it, and Mara answered all of them. And when the last of them was answered, Winslow sat back in her chair and looked at the recording device for a moment. "I've reviewed the clinical documentation," Winslow said. "The admission record, the ICP indicators, the transport timeline, the outcome data. I've also reviewed the portion of your service record that was declassified yesterday evening." She paused. "I want to ask you a direct question, and I want you to know that this is not a hostile question." "Go ahead," Mara said. "In your assessment, was there any point during the MCI response yesterday at which Dr. Theld could have taken clinical command of the emergency department's response?" She thought about the security badge logs. Theld's timestamp at 8:04, the patients arriving at 8:11, the 96-minute window. "In my assessment," she said, "yes. From the point of the first patient arrival through the period of most acute need, there was a window in which the head of emergency medicine was in a non-clinical area of this hospital, while the clinical staff managed a mass casualty event without department leadership." Winslow made a note. "Thank you," she said. "I think we have what we need from this session. We may follow up in writing if additional questions arise." "That's fine," Mara said. She stood to go and Winslow said, "Ms. Calloway." She looked up. "I read your written statement last night," Winslow said. "The clinical rationale section, the framing of the decision-making process in the Wen procedure." A pause. "It was very clearly written." "I learned to write that way in the Army," Mara said. "It shows," Winslow said, and it was the kind of compliment that didn't require acknowledgement, just reception. Mara went back downstairs. The information started breaking publicly around 11 that morning. She was at the nursing station when Brent came to her with a phone screen, a local Dunmore news station's website, updated 47 minutes ago, carrying a report that the Colorado Department of Health had opened a formal investigation into Dunmore General Hospital's emergency response to the Carver refinery disaster, with specific reference to the conduct of an unnamed senior physician who had allegedly been absent from clinical duty during the peak of the mass casualty event. The story didn't name Theld, but it named the hospital and it named the timeframes, and anyone who knew how the department was structured could fill in the rest. By noon, 2 more outlets had picked it up, with additional details that suggested someone, multiple someones, had been talking to reporters. A statement from a hospital employee describing the medication incident from the previous morning. A statement from a first responder describing the triage situation upon their arrival. A statement from a source described only as a military official, confirming that federal medical personnel had been deployed to the hospital and had operated under a specific authorization framework. She did not know who had talked to the press. She had not, and would not. That was not her work. But by 12:30, when she was in Bay 11 checking on a late overnight patient, one of the last of the refinery workers, a 60-year-old man named Douglas Harrell, who had come in after midnight with a delayed inhalation presentation. The charge nurse came in to tell her that there were reporters outside the main entrance. "How many?" she asked. "3 cameras," the nurse said, "and I think 2 print, maybe 3. "Keep them outside," Mara said. "Obviously," the nurse said. "But administration wants to know if you'll make a statement." "Tell administration I'm seeing patients," she said. The nurse left. Douglas Harrell, who had been listening to this exchange with the attentive quiet of a man who has been in a hospital bed long enough to find other people's conversations. The primary entertainment said, "Are you famous now?" "No," Mara said. "You kind of sound famous." "I sound like someone who needs to check your oxygen saturation," she said, and did. The board called her up at 2 in the afternoon. Not a summons, exactly. Gaunt's assistant called her cell and asked if she could meet with the full medical executive committee at her convenience, which in hospital speak means immediately, but with the courtesy of a question mark attached. She said she could be there in 10 minutes. The boardroom was fuller than she'd expected. Gaunt was at the head of the table. To his right was a woman she didn't recognize who was introduced as the board's legal counsel, a brisk woman named Patricia Helm, who had the slightly coiled energy of a lawyer in the middle of a situation that is moving faster than her planning assumed. Ferris was there, seated 2 chairs from Gaunt, with the particular posture of someone who has spent the last 24 hours revising her position and is not entirely sure where the revision lands. 2 other board members Mara recognized by face, but not by name, were there. And at the far end, unexpectedly, was Voss, in uniform, seated with the particular stillness of someone who is present not as a participant, but as a fact. Gaunt opened without preamble. "Ms. Calloway, thank you for coming. We'll be direct." "Please," she said. "The board has completed its preliminary review of yesterday's events. We have the clinical records, the security footage, the pharmacy documentation, the administrative communications, and the statements provided by clinical staff, first responders, and federal personnel." He folded his hands on the table. "The investigation into Dr. Theld's conduct during the mass casualty event has been formally opened with the state's Physician Oversight Board. His clinical privileges at this hospital are suspended indefinitely, which is a step beyond the pending review suspension communicated to you last night." Indefinitely. That was different from pending review in a way that was not subtle. "Additionally," Gaunt said, "the board has reviewed the formal complaint Dr. Theld filed with the State Medical Licensing Board yesterday morning. We have submitted a statement to that board indicating that in our assessment, the complaint was filed without clinical basis and in contradiction of the documented patient safety record." He looked at her. "We are asking the state board to consider whether the filing constitutes a violation of professional conduct standards." She absorbed this. Using the complaint mechanism as a weapon to neutralize a nurse who had caught a dangerous medication error and documented it was the kind of thing that, if the licensing board agreed it was intentional, carried its own category of professional consequences separate from the MCI conduct review. She had not asked for this. She had not suggested it. The board had arrived at it through the same documentation she had submitted to everyone else. "I want to be clear," she said, "that I didn't request that referral." "We know," Gaunt said. "It's the board's decision, not yours." Helm, the legal counsel, spoke for the first time. "Ms. Calloway, given the complexity of the legal and regulatory landscape around yesterday's events, the hospital would like to offer you access to independent legal representation at the hospital's expense, should any proceedings require it. This is a protective measure. It doesn't constitute any admission of wrongdoing on the hospital's part." "I'll consider it," Mara said. Gaunt cleared his throat. "There's one more thing we need to address. Your employment status." She waited. "The administrative leave placed on you yesterday morning has been formally rescinded," he said. "The board has voted to reinstate you with full privileges and back pay for the period of leave." He looked at the table for a moment. "We also want to discuss, and this is not a formal offer yet, it requires further development, a potential role for you in our MCI preparedness and training program, drawing on your qualifications and experience. That conversation would happen separately and at your pace, but the board wanted you to know it's on the table." Ferris, who had been silent through all of this, looked up. Her face had a quality that Mara took a moment to read. Not remorse exactly, more like the expression of a person who has found themselves on the wrong side of a sequence of events and is trying to understand how they arrived there. "Ms. Calloway," Ferris said, She stopped. Mara waited. "I followed the process as it was presented to me yesterday morning," Ferris said. "I should have done more due diligence before acting on Dr. Theld's complaint. That was a failure of my role, and She pressed her lips together. "I'm sorry." Mara looked at her for a moment. "Noted," she said. It was not warm, but it was not cruel, and it was what she had, and she thought Ferris understood the register. She left the board meeting and took the stairs down, and on the second-floor landing she stopped and sat on the step and put her head back against the wall for a moment. The reinstatement was real. The back pay was real. The investigation was real. The complaint referral was real. The MCI training conversation was real. All of these things were real and had happened inside 24 hours of the morning. She had walked out of this building without her badge, and stood in a parking lot with the ground shaking under her feet. She sat on the step for 3 minutes. Then she went back to work, because there were still patients and she was still their nurse, and the continuity of that was the most solid thing in the building. The afternoon brought its own rhythm. She finished her rounds, supervised Reyes through a complex wound assessment in a burn patient, reviewed the medication reconciliation for 3 transfers to the general medical floor, and at 4:15 stood in the corridor outside Bay 4 one more time and watched through the window as Dr. Felsner reviewed the portable imaging results with Tobias and his mother, his posture and their posture together telling the story of good news delivered and received. It was around 5 that Voss found her again, which had become a pattern she found she didn't mind. He handed her a folder, not heavy, 4 pages inside. Formal record, he said, declassified service summary. What the board has, what the state's licensing office has, what the DIG's office has. He nodded at the folder. It's yours to keep, your copy. She opened it. Her name at the top, service dates, unit designation. 3 deployment entries. The trauma specialist certification, the field surgical qualification. 4 commendations, 2 of which she had not thought about in years. A summary note from the Army Medical Credentialing Office that was written in official language and said, in official language, that the person named in this record was among the most qualified trauma practitioners the unit had trained in the relevant period. She closed it. Thank you, she said. I should have pushed for the declassification earlier, Voss said, before any of this required it. I asked you not to. I know. I'm still saying it. She looked at him. If you'd pushed for it before I asked you to, I'd have been angry. I know that too, he said. Still. She tucked the folder under her arm. Is there anything else your office needs from me this week? Written confirmation of the consulting arrangement for the remote neuro support on the Wen case. Formality. I'll send it tonight. He nodded. He started to leave and then turned back in the way he'd been doing all day, and she waited for the thing he had not said yet. The media situation is going to get bigger before it gets smaller, he said. I figured. You're going to have people asking for interviews. The story about the fired nurse who came back and ran the disaster response. It's already on 2 regional news sites, and one of the wire services picked it up an hour ago. I know, she said. I'm not giving interviews. You don't have to. I just wanted to make sure you knew it was out there. I know, she said again. He left. She was 2 steps from the nursing station when her phone buzzed, and this time it was a number she recognized. Dr. Reginald Foss, State Licensing Board, the same man who had called her at 10:50 the previous night with the provisional dismissal of Theld's complaint. She answered, Ms. Calloway. His voice had a different quality from the previous night's call, more formal, more weighted, carrying the specific gravity of official news. I'm calling to inform you that the State Medical Licensing Board has completed its expedited review of the complaint filed by Dr. Marcus Theld yesterday morning. The board dismissed it provisionally last night, she said. This is a final determination, Foss said, not provisional. A brief pause. The board has voted unanimously to formally dismiss the complaint and to enter a finding that the complaint was filed in bad faith, in direct contradiction of documented clinical evidence, and in a context suggesting an attempt to use the complaint mechanism to obstruct a legitimate patient safety action. She stood still. That finding, Foss continued, has been entered permanently into Dr. Theld's licensing record. It is a reportable adverse action. A reportable adverse action on a physician's licensing record was not a small thing. It was a mark that traveled with the license, that appeared in the National Practitioner Database, that had to be disclosed in credentialing applications at every institution the physician applied to that stayed. Additionally, Foss said, the board's conduct review of Dr. Theld's behavior during the mass casualty event yesterday, in combination with the bad faith complaint finding and the reports received from the hospital's medical executive committee, has led the board to initiate an emergency suspension hearing. That hearing is scheduled for Thursday of this week. He paused. Given the evidence already in the board's possession, I am not in a position to predict an outcome, but I can tell you that an emergency suspension hearing is an unusual step that the board does not take lightly. She understood what he was telling her without him having said it. Thank you for calling, she said. Of course. He hesitated, the same small hesitation as the previous night. I also want to inform you that the board's licensing committee met this afternoon regarding the veteran healthcare provider statute I mentioned. They have formally placed your name on the agenda for the next licensing review cycle, which is in 3 weeks. Another pause. You would need to submit a formal application. The committee wants to make clear that the process is competitive and that no outcome is guaranteed. But given your record, Ms. Calloway, given what we've been able to review, the committee would like the opportunity to consider it. She looked at the folder under her arm. 4 pages. Her name at the top. A military medical credentialing note that called her one of the most qualified trauma practitioners of her cohort. I'll submit the application, she said. Good, said Foss, and the word carried a warmth that was slightly outside the formal register, like a door opening a few inches more than it needed to. The committee will be in touch. She hung up. She stood at the nursing station with the folder under her arm and her phone in her hand and the sound of the emergency department around her. Monitors, voices, the distant PA, the rhythm of a place that had been through something large and was still going, still doing the work, still receiving the people who came through its doors in the worst moments of their lives. She thought about what was coming. The Thursday hearing, the licensing application, the DIG's formal report. The media that Voss had told her would keep growing. The MCI training conversation Gaunt had mentioned, unformed and tentative but real. The statement she still needed to write for the federal consulting record. She thought about all of it, and then she set it aside because there was a patient flag on the board that needed attention, and the patient didn't care what was happening in the boardroom or the licensing office or the morning news. She went to the board. She read the flag. She went to the bay. The evening moved forward the way evenings in emergency departments move forward, not with any dramatic resolution, but with the accumulation of smaller things, each one its own whole world to the person it was happening to, each one requiring the full measure of attention she had learned a long time ago in a very different context to bring to exactly this kind of moment. At 7:48, Brent handed off to the evening charge and stopped at the nursing station to drop off a piece of paper. She looked at it. It was the triage log from the previous morning, the physical copy, time-stamped, with her initials at the top in the handwriting she'd used when she'd established the triage flow at the ambulance bay door. Brent had attached a sticky note that said, in his handwriting, "Admin found this in the bay, figured it should be yours." She held the paper for a moment. 42 names on the first 2 pages, the color codes, the timestamps, the distribution she'd made between the red and yellow and green categories in the 37 minutes before the federal team arrived and added their systematic capacity to hers. 42 names, and attached to each name, without any of them knowing it, a decision she had made in approximately 4 seconds, using knowledge she had spent 4 years acquiring in conditions that bore no resemblance to an October morning in Dunmore, Colorado. She folded it carefully and put it in her jacket pocket. She was still at the station when the administrative elevator opened and Gaunt came out, not in the purposeful way of someone on institutional business, but in the slightly uncertain way of someone who has decided to go somewhere and is not entirely sure of their welcome. He walked to her directly. "I just got off the phone with Patricia Helm," he said, "and with Dr. Foss's office." She nodded. "I spoke with Foss this afternoon." "Then you know about the suspension hearing." He paused. "I also want you to know that Theld was formally notified this afternoon that his office in this building has been placed under administrative hold. His credentials are suspended. He cannot access clinical areas of this hospital, and his access to patient records has been revoked." She processed this. "Is he contesting?" she asked. His attorney filed a response. Gaunt looked at the floor for a moment. It was not well positioned. He looked back up. "Ms. Calloway, I've been board chair here for 4 years. In that time, I've managed difficult physician situations. I've managed complaints and reviews and suspension proceedings." He shook his head, a small motion. "I have never had a case where the documentation across every single line pointed as uniformly in one direction as this one does." She said nothing. The pharmacy log, the security footage, the clinical records, the military documentation, the federal response record, the patient outcomes. Every single document in this case tells the same story. He looked at her directly. "You caught a dangerous error. He punished you for it. He abandoned the department during a disaster. And then he tried to protect himself by filing a complaint that the evidence directly contradicts." "I know," she said quietly. "I want to make sure you know that we know." he said. The board. Not just me. Unanimously. She held his gaze for a moment. Thank you, Dr. Gaunt. He nodded once and went back to the elevator. She turned back to the board. And that was when she saw it. A new entry, added by the registration desk in the last 4 minutes, flagged for triage review. The patient's name was Marcus Theld. He had walked in through the main entrance at 7:51 and presented to the registration desk with chest pain and shortness of breath. He was currently in the waiting room. The triage nurse had flagged the case for standard cardiac protocol and was waiting for an available bay. Bay 3 was open, the same bay where Margaret Tolley's heart had destabilized and restabilized 24 hours earlier. Mara stood at the board and looked at the entry. She thought about the look on his face in the parking lot last night. That stripped rawness, the look of a person beginning to understand the full dimensions of what they had done. She thought about the suspension hearing in 2 days. She thought about the reportable adverse action now permanent in his licensing record. She thought about a man who had spent 20 years building an identity around his authority in a specific place and had arrived at a Tuesday evening walking through the main entrance of that place as a patient. She picked up the triage clipboard. She walked to the waiting room. He was sitting in the third chair from the door, still in street clothes, leaning forward with his elbows on his knees in the particular posture of someone who has been trying to convince themselves they don't need to be here and has run out of convincing. He looked up when she came through the door. Their eyes met. The waiting room had 6 other people in it, none of them paying attention. The overhead fluorescents were the same as the ones everywhere else. Slightly too bright, the same buzz she'd stopped noticing at hour 3 yesterday. She pulled the chair from the triage station. She sat across from him. She said, "Tell me what you're feeling." And he looked at her. This man who had thrown her badge on the floor, who had called her a liability, who had stood in an emergency department while it burned around him and walked to an administrative elevator instead, who had filed a formal complaint against her using the word non-emergency to describe a 16-year-old's arterial brain bleed. And his face did the thing that faces do when the last performance falls away. "Chest pressure," he said. His voice was flat. "Started an hour ago. Left arm." She reached for the pulse oximeter. "Any radiation to the jaw?" "Some." "Rate the pressure for me, 1 to 10. 6, he said. "Maybe 7. She clipped the sensor to his finger. His saturation was 94, which was lower than she wanted. "Any history of cardiac events?" she asked. "No." "Current medications?" He listed them. She listened. She stood. "Bay 3, she said. "I'll walk you in." He looked at her. Something passed across his face that she didn't name. "Why?" he said. Not a full question. More like the first word of one he didn't finish. She looked at him. "Because that's what I do," she said. She held the door open. He stood up slowly, with the particular careful movement of a person who is frightened of their own body, and walked through it, and she followed him back into the department where, 24 hours earlier and 11 minutes after she had been escorted to a parking lot, she had made the first triage decision of a mass casualty event that would be reviewed by state investigators, federal authorities, and a licensing board for the next several months. She walked him through the department to Bay 3. 3 nurses clocked the entry. She saw their faces register who the patient was. She met their eyes one by one, and each of them, understanding what the look meant, went back to what they were doing. She got him into the bed. She connected the leads. She watched the first tracing come up on the monitor, the familiar pattern of the 12 lead organizing itself into a picture of a heart under stress. She looked at the tracing. She had been right to bring him in. And she was still looking at it, still reading the specific elevation in leads 2 and 3 and AVF that was telling her exactly what kind of night this was going to be, when her phone buzzed with an incoming call from a number she didn't recognize, a Denver area code, which meant it was either the state board's main office or one of 2 federal offices she had been in contact with in the last 24 hours. She stepped out of the bay. She answered it. "Miss Calloway." The voice was male, older, carrying the specific weight of institutional seniority. "My name is Harmon Briggs. I'm the senior investigator for the Office of Inspector General, Healthcare Division." A brief pause. "We've been monitoring the situation at Dunmore General Hospital over the last 24 hours, and we've received documentation from the Colorado DOH's Disaster Review Office, the State Licensing Board, and Colonel Voss's Federal Response Office." She stood in the corridor outside Bay 3. Yes, she said. I want to inform you that the OIG is opening a formal federal investigation into the events at Dunmore General Hospital on October 15th of this year, Briggs said. This investigation will encompass the medication safety incident, the mass casualty response, the emergency complaint filing, and certain administrative communications that were flagged during the DOH's preliminary review. She closed her eyes for a moment. Certain administrative communications, she said. We're not in a position to detail the specific scope at this stage, Briggs said. But I want to be direct with you, Ms. Calloway. We have evidence suggesting that the complaint filed against you was not the first time the mechanism was used in this manner by the physician in question. There are other cases, other nurses, other staff members who raised safety concerns in this department in the last several years. A pause. We'd like to speak with you in detail about your observations during your tenure here. She stood in the corridor. Behind her, through the bay door, the cardiac monitor was tracing Marcus Theld's compromised heart in the precise, unsentimental language of electrical signals. In front of her, the department continued its evening work, the steady rhythm of people doing the thing they came here to do, caring for patients, managing the gap between what the body can sustain and what it cannot. She thought about other nurses, other safety concerns, other complaints that might have been used the same way this one had. She thought about how many times she had heard, in 9 years of working this department, a colleague say, I flagged it, but it didn't go anywhere, or I tried to raise it, or I didn't bother because. She had not known it was a pattern. She had not known until this phone call that her single morning, the badge on the floor, the parking lot, the 41 seconds, might be the visible edge of something that had been operating under the surface of this department for years. I'll speak with you, she said. Thank you, said Briggs. We'll be in touch tomorrow to arrange the interview. He paused. Ms. Calloway, the OIG's interest in this case is substantial. I want you to understand the scope of what that means. I'm beginning to, she said. She hung up. She stood in the corridor for a moment, then she pushed open the door of Bay 3 and went back to her patient. The cardiac monitor in Bay 3 was telling her what she already suspected. Inferior STEMI. The elevation in leads 2, 3, and AVF was unambiguous. The clean, insistent climb of ST segments that meant a blocked right coronary artery and a heart muscle beginning to starve. The supplemental pattern in V4 through V6 added a lateral component that made the picture worse. Not unsurvivable. Not yet. But the window for intervention was the same kind of window all cardiac windows were. Finite, unforgiving, and closing. She came back to the bedside and looked at the tracing and then at the man in the bed. Theld was watching her face. He had been watching her face since she sat down with the triage clipboard in the waiting room, with the particular attention of someone reading a verdict in an expression rather than waiting for the words. He was not performing now. The authority, the posture, the precise management of how he occupied a room, all of it had compressed into the physical reality of a 61-year-old man in street clothes attached to a cardiac monitor, waiting to be told what the machine had found. Inferior STEMI, she said. You need the cath lab. He closed his eyes. It was not a long closure. 3 seconds, maybe 4. Then he opened them again and looked at the ceiling with an expression she did not try to read because it was not hers to read. Who's the interventional cardiologist on call? He asked. Dr. Serrano. A pause. She's good. She's excellent, Mara said, and picked up the phone. She called the cath lab. She called Serrano's cell. She called the charge nurse for the notification protocol and gave the information in the specific rapid shorthand of a nurse who has activated cardiac protocols before and knows that every word past the essential ones is time. She got the IV access established, 2 large bore lines, right antecubital and left forearm, and drew the troponin and the panel while she was there, labeled them, handed them off. She pushed the aspirin. She pushed the heparin. She attached the continuous monitoring leads and watched the tracing scroll. Theld did not speak during any of this. He watched her work with the same stripped-down attention as before, and she worked around him with the efficiency of someone doing a job she had done hundreds of times. And the bay existed in the particular intimacy of a medical emergency, which is one of the stranger intimacies available to human beings. 2 people who are not friends, in some respects are the opposite of friends, compressed together by the specific emergency of one person's body. When she had done everything she could do before the cath team arrived, she stood at the foot of the bed. "Your wife has been notified?" she asked. "We separated 8 months ago." She noted this. "Is there someone we should call?" He looked at the ceiling again. "My daughter. Her number is in my phone. I'll need the phone to access the contact." He reached into his jacket pocket. He held the phone out to her without looking at her, and she took it, and she found the contact listed as Ellie, and she handed the phone to the charge nurse with the contact open. When she came back to the bedside, he was looking at her. "You're going to be okay," she said. Not as reassurance exactly, more as clinical estimate. "Serrano is going to get the blockage, and you're going to be okay." "You don't know that," he said. "No, but the presentation is consistent with a manageable event, and the intervention window is good. Those are the facts I have." He was quiet for a moment. "Why?" he said again. The same unfinished question from the waiting room. She understood this time that he wasn't asking about her decision to treat him. I was asking something larger, something that required her to account for the gap between what he had done and what she was doing, and she thought about how to answer it honestly without making it about more than it was. "Because you're a patient," she said. "That's the beginning and the end of it." He looked at her for a long moment. "I know what I did," he said. "Yesterday morning. The complaint." He stopped. His jaw moved. "I know what I did during the response." She waited. "I don't expect you to—" He stopped again. "I'm not asking for anything." "I know," she said. The cath team arrived 4 minutes later, and she stepped back and she gave her report to Serrano at the bay threshold with the clean efficiency of a handoff, the timeline, the tracing, the medications given, the access sites, the vitals trending. Serrano listened with the focused absorption of someone receiving a complete picture and integrating it in real time. "Good catch in the waiting room," Serrano said. "He walked in with it," Mara said. Serrano looked at her for a moment. She was aware that Serrano knew who the patient was. Everyone in this building knew who the patient was within 10 minutes of his arrival. And she was aware that Serrano was reading something in her face about how she was carrying this. "You okay?" Serrano asked. "Yes," Mara said. "Take care of him?" She stepped back. She let the cath team move the bed. She watched them go down the corridor toward the elevator, and she stood at the threshold of Bay 3. The same bay where Margaret Tolley's heart had reorganized itself. The same bay where she had pushed lidocaine with Pete at her elbow. And she felt the strange, specific weight of a day that was not yet finished being what it was. She went back to the nursing station and documented everything in the order it had happened, with the timestamps and the clinical rationale and the medications given, and she filed it with the same thoroughness she had filed everything in the last 2 days, because the record was the record regardless of who the patient was. Then she went home and slept for 9 hours without interruption, which was something her body decided without consulting the rest of her stats. The Thursday hearing was held at the Colorado State Medical Licensing Board's offices in Denver, in a room that was deliberately unremarkable. Pale walls, a long table, 7 board members seated with the formal arrangement of people exercising institutional authority. Mara had been asked to appear as a witness, not as a party, and she sat in the gallery with Voss to her left and Patricia Helm, the hospital's legal counsel, 2 rows back. Feld was present. He had been discharged from Dunmore General 48 hours after his cath procedure, 2 stents placed, prognosis good with cardiac rehab, and medication compliance. He sat at the respondent's table in a dark suit with his attorney beside him, and he looked like himself physically, the same posture, the same height. But something in the quality of how he occupied the room had changed, and Mara noticed it the same way she noticed clinical details. Not trying to, just the way her attention worked. The board's chair opened the session at 9:02, and the first hour was documentation. The presentation of evidence in the formal order the board had established, which meant the pharmacy records first, then the clinical record from the MCI response, then the security footage. The security footage was not shown in its entirety. A 16-minute segment was shown, time-stamped, covering the period from 8:03 to 8:19 on October 15th. It showed Feld at the administrative elevator at 8:04. It showed the first ambulance arrival in the external camera feed at 8:11. It showed Feld in the administrative corridor at 8:16 and 8:19, the camera tracking him walking away from the elevator and toward the administrative wing. It did not show him in the clinical area. His attorney offered the administrative coordination argument that Theld had been managing the hospital's institutional response from the administrative level, coordinating with external agencies, managing communications. The board's examining attorney asked for the documentation of those communications. Theld's attorney provided 3 emails and a phone log. The board's examining attorney noted that the 3 emails were sent between 8:40 and 9:15, that the phone log showed 2 outgoing calls of 40 seconds and 1 minute 12 seconds, respectively, and that the remaining 91 minutes of the security footage gap were unaccounted for by any administrative activity documentation. There was a silence in the room after that which had a specific quality. Mara did not look at Theld during this exchange. She looked at the board members, at their faces, at the 7 different expressions of people processing information that confirmed what they already suspected. The OIG's senior investigator, Harmon Briggs, testified in the second hour. He presented findings from the federal investigation's preliminary phase, a review of 6 years of formal complaints filed within Dunmore General's Medical Executive Committee structure, cross-referenced with nursing and allied health staff records. The findings were specific and documented, and they were worse than Mara had imagined when Briggs had first told her there were other cases. 11 complaints, filed over 5 years, 7 of them against nursing staff, 5 of them involving medication safety concerns that had been raised by staff and then followed by formal complaints against the staff member who raised them. 3 of the nursing staff members whose complaint histories were detailed in the OIG report had resigned from the hospital within 12 months of the complaint being filed against them. 11 complaints, 7 nurses, a pattern that had been invisible in the individual record of each case and visible only when the cases were viewed together, which was what a federal investigation made possible. Mara listened to Briggs read the summary findings and felt something that was not quite anger. Anger was too hot for what this was, but was the colder cousin of it, the feeling of understanding something retroactively that should have been understood sooner, the specific weight of imagining 7 people sitting in 7 parking lots on 7 different mornings. Voss put his hand on the table between them, not touching her, just close enough that she was aware of it. She appreciated the gesture without acknowledging it. Theld's attorney argued strenuously during the response period. He challenged the statistical methodology of the pattern analysis. He argued that each case had been reviewed individually and found procedurally appropriate at the time. He argued that the bad faith finding on the Callaway complaint was being used to retroactively recontextualize cases that had nothing to do with it. The board members asked questions. They were not friendly questions. At 12:40, the board chair called a recess. At 1:15, the session reconvened. The board chair spoke for 11 minutes. She went through the findings in the order they had been presented, and she spoke with the measured precision of someone who is aware that what they are saying is going to appear in a public record and wants the public record to be exact. She cited the medication safety incident and the patient outcome. She cited the MCI response and the security documentation. She cited the bad faith complaint finding and the OIG's pattern analysis. She cited the individual case records of the 7 nursing staff members identified in the federal review. Then she said, "The board has voted unanimously to suspend Dr. Marcus Theld's medical license pending a formal revocation hearing. The suspension is effective immediately and encompasses all clinical practice within the state of Colorado. The revocation hearing will be scheduled within 60 days. Theld did not move. His attorney put a hand on his arm and said something quietly, and Theld shook his head once, a small motion, and continued looking at the table. Additionally, the board chair said, the board is referring the pattern of complaint filing identified in the OIG's preliminary report to the State Attorney General's office for review of potential violations of whistleblower protection statutes. That referral is being made today. The Attorney General referral. That was beyond the licensing board's immediate jurisdiction, extending into a territory where the consequences were not professional, but potentially legal. Mara looked at her hands on the table. She thought about the 7 nurses. She thought about the ones who had resigned. She thought about what it cost a person to raise a concern about patient safety and then be made into the problem, to go through that experience and decide it wasn't worth trying again, or that this department wasn't a place where trying was safe, or that the cost was simply more than they could carry. She thought about the patients who had been in those rooms during those 6 years, the ones whose safety concerns had been raised and then buried under a complaint mechanism used as a shovel. She did not feel satisfaction. She had expected to feel something closer to satisfaction, and she was mildly surprised to find that what she felt instead was a kind of grief. Not for Theld, but for the years. For the distance between what this department could have been and what it had been allowed to become. For the specific waste of all that professional courage spent on concerns that were real and then made to pay for being real. She felt that. Then she let it move through her and filed it in the part of herself that would carry it forward, because grief is only useful if you do something with it. After the session, in the corridor outside the boardroom, Briggs found her. "The AG's office will want to speak with you separately," he said. "The whistleblower referral will likely widen the investigation to include the former staff members identified in the OIG report, if they choose to come forward." "Will you be contacting them?" she asked. "Our office will reach out, but these things move at the speed they move." He looked at her directly. "What you submitted to this investigation, the clinical documentation, the timeline, the statement regarding the pattern of conduct you observed during your 9 years at Dunmore General, that's what made the pattern visible. The cases were there. Nobody had looked at them together before." She thought about 9 years of working in a department where something had been wrong under the surface, and she had not looked at it as a pattern either, had not connected the individual things into a systemic picture, had raised the concerns that were in front of her, and not looked for the ones that weren't. "I didn't see the pattern," she said. "You weren't supposed to be able to," Briggs said. "That's how these things work. Each case looks like its own situation. The pattern only shows when someone has the access and the mandate to look at them together." He paused. "That's what investigations are for." She nodded. She went back to Dunmore. The licensing committee review was held 3 weeks later, and it lasted 1 hour and 20 minutes, which was longer than the standard review, but shorter than she had been told to prepare for. Her service record, her trauma certification, the field surgical qualification, the emergency medicine equivalency, the outcome record from the October 15th response, 17 critical patients managed, 3 deaths unrelated to her interventions, Tobias Wen's neurological recovery progressing on schedule, the clinical documentation from the MCI that Reginald Foss's office had described as among the most thorough they had reviewed. The committee asked her questions that were different from the board's questions and different from the OIG's questions. They asked about her understanding of scope, about how she made decisions in emergency conditions, about what she thought the limits of the veteran healthcare provider pathway were and where she thought those limits should be. She answered honestly, including the parts where she was uncertain. When they asked about her plans, whether she intended to practice independently, whether she was considering a medical school pathway, she told them the truth, which was that she did not know yet, that she was thinking about it, that what she was certain of was that she intended to keep working in emergency medicine in some capacity, and that she would use whatever credentials she earned in the way they were meant to be used. The committee chair, a woman named Dr. Renata Silva, who had been practicing emergency medicine for 30 years, and had the particular authority of someone who had earned it from the inside, looked at her over the table for a moment. "The statute was designed for situations like yours," Silva said, "not the circumstances that brought it to everyone's attention. The underlying qualifications, the work you actually did, the training you actually received. That's what the statute is for." "I understand that," Mara said. "Good." Silva looked at her folder. "The committee will deliver its recommendation in writing within 10 business days. Whatever the recommendation is, you'll have the full basis for it." Mara thanked them and left the room. In the elevator down, she stood with her reflection in the metal doors and thought about the specific distance between the woman who had walked out of Dunmore General 3 weeks ago with her keys in her hand and the woman standing in this elevator now, and she could not easily calculate it because the distance was not the kind that could be measured in time or events. It was the kind that opened up inside a person when something they had built around a deliberate decision, the quiet life, the ordinary hours, the choice to be one thing and not the other, is dismantled by a single morning and does not reassemble in the same shape. She did not know what shape it was assembling into. She was beginning to think that was acceptable. The state medical board's formal ruling came 8 weeks after the Thursday hearing. Dr. Marcus Theld's medical license was permanently revoked. Not suspended pending revocation, revoked. The board's ruling detailed the basis: abandonment of clinical duty during a declared mass casualty event, systematic misuse of the formal complaint mechanism over a period of 6 years, conduct inconsistent with the obligations of a licensed physician to patient safety and to the integrity of safety reporting systems. The revocation was entered into the National Practitioner Database the same day the ruling was issued, which meant it appeared immediately in the credentialing systems of every hospital in the country that checked that database, which was all of them. He could not apply for hospital privileges anywhere. He could not practice in any state without a valid license, and the permanent revocation in Colorado would follow any application for licensure in another state. The Attorney General's office had opened its investigation into the whistleblower protection violations 2 weeks earlier. That process had its own timeline and its own pace, but Briggs had told her it was moving, and she trusted the characterization. 3 of the 7 nursing staff members identified in the OIG report had come forward. Their cases were being reviewed. 2 had retained attorneys. 1 had filed a formal complaint with the AG's office directly. Mara did not know all of their names. She knew one of them, a woman named Terry Oakes, who had worked in the department 5 years ago and had left 18 months after a complaint was filed against her for raising concerns about medication documentation practices in the ICU. Terry Oakes had sent her an email through the hospital's general contact system, a short email, 2 paragraphs, that said in the first paragraph that she had followed the news coverage, and in the second paragraph that she was glad someone had finally not let it be buried. Mara wrote back. She kept it simple. She said she was glad Terry had reached out, and she meant it. The licensing committee's recommendation arrived on a Tuesday. She was in the break room when she read it on her phone. The formal letter from Foss's office, attached as a PDF. 3 pages of official language that she read from the beginning to the end without skimming because official language rewards reading. The committee unanimously recommended that Mara Calloway be granted a licensed independent practitioner designation under the Colorado Veteran Healthcare Provider Statute, with a scope of practice encompassing emergency medicine, trauma management, and advanced procedural care within a hospital-based emergency setting. She read it twice. She put her phone in her pocket. She went back to the nursing station where Brent was reviewing the afternoon board, and she stood next to him for a moment. "You okay?" he asked. "Yes," she said. He looked at her with the particular attention of someone who has worked with a person for 9 years and learned to read the small calibrations of their expression. "Something happened." "I got the committee recommendation," she said. He stopped looking at the board. "And?" She told him. Brent set down his clipboard. He looked at her with an expression that was doing several things at once, processing the information, feeling something about it, trying to decide whether she wanted him to make something of it or treat it like the ordinary piece of news she was presenting it as. She watched him decide. "Mara," he said. "I know," she said. I know." He looked at her for another moment. "Are you going to—" "I don't know yet," she said. "The medical school conversation is still open. Gaunt's MCI training offer is still open. There are a few different shapes this could take." She looked at the board, the familiar grid of bays and patient names and status flags, the triage board she had been reading for 9 years and had read differently for the last 8 weeks since the morning the ground had moved. "I'm not in a hurry to decide." "Good," Brent said. Yeah, good." He picked up his clipboard. She went to see her patients. Tobias Wynn's 30-day MRI came back clean. Felsner called her directly to tell her, which was not something attending physicians typically did for nursing staff, and she appreciated the directness of it. The images showed no residual hemorrhage, no hydrocephalus, no secondary complications from the procedure. The trajectory of his recovery was, in Felsner's word, excellent, which was a word he deployed sparingly and which she weighted accordingly. She went to see Tobias the day of the MRI result, not because it was clinically necessary, he had been discharged 3 weeks prior, but because he and his mother had come in for the imaging and she happened to be on shift and the timing aligned. He was in the radiology waiting area when she found him, sitting with his mother, who had brought a canvas bag that probably had snacks in it and looked like the kind of mother who brought snacks to medical appointments, which Mara found unexpectedly affecting. Tobias had his phone out and looked up when she came in with the quick recognition of a person who has not forgotten a face they associated with an important moment. "Hey," he said. "Hey, Dr. Felsner give you the results?" "Yeah." He looked at his hands, then back at her. "Clean." "Clean," she confirmed. His mother made a sound. He looked at Mara with the direct quality she had come to recognize as specifically his, the 16-year-old who asked whether doing something hard for someone had hurt the person doing it because he wanted to know what had been done for him. I heard about everything that happened, he said, after, with the doctor and the investigation. It's ongoing, she said. I heard you're not just a nurse. He said it without the specific weight people sometimes put on the word just, which she noticed. I mean, you were in the army. You did stuff. I did some things a long time ago, she said. And then I came home and I was a nurse, and that was its own thing. But now you're still a nurse, she said, and maybe some other things, eventually. We'll see. He nodded slowly, processing this in the way he processed things, thoroughly, without rushing. Do you think you'll stay here, at Dunmore General? She looked at him. For now, she said. He nodded again. Good, he said. And then, with the earnest plainness of a teenager saying the thing they mean, I'm glad you were there. She looked at him. This kid who had gone to work one morning and walked into the radius of a disaster and survived it because of a sequence of decisions made by people he had never met, doing jobs he had not understood the depth of. She thought about what she wanted to say, and she found that what she wanted to say and what she was able to say were briefly not the same thing, which was a gap she allowed to exist for a moment before she closed it. Me too, she said. She left him with his mother and her canvas bag of snacks and went back to the department. Well, the day they formally processed her independent practitioner credentials into the hospital's system was a Wednesday, 6 weeks after the committee recommendation, and it happened in the middle of a shift, which she had specifically requested because she did not want a ceremony or an event or any organized acknowledgement. Gaunt came down to the floor and handed her the physical credential card himself, and she took it and looked at it, her name, the designation, the scope statement, and she held it for a moment and then put it in her pocket next to the triage log she still carried from October 15th. She hadn't planned to keep carrying that, but she hadn't decided to stop either. Gaunt looked like he wanted to say something significant. She said, "Thank you, Dr. Gaunt. I have a patient in Bay 2. He almost smiled. Of course. She went to Bay 2. The patient was a 50-year-old woman named Clara who had come in with abdominal pain that had turned out to be a presentation of something that required urgent imaging and a surgery consult. And Clara was frightened in the specific way of someone who came in expecting to be told it was nothing and is now confronting the reality that it is something. Mara sat with her for 15 minutes after the surgery team had been paged. Not because sitting there was in the protocol, but because Clara was alone and the 15 minutes were available and it was the right thing to do. "Is it going to be okay?" Clara asked. Mara looked at her. She thought about the things she could say and the things she knew and the gap between them, which she had learned to navigate honestly. "I think the surgery team is going to give you a very clear picture of what's happening and what the options are," she said. "And I think you're in the right place, and you're going to be able to make good decisions with good information." "That's not quite what I asked," Clara said. "No," Mara said. "It's not, because I don't know the answer to what you asked. But I know you came in when something felt wrong, which is what you're supposed to do, and I know you're here now." She held Clara's gaze. "That part you did right." Clara was quiet for a moment. Okay, she said. "Okay." Mara stayed until the surgery consult arrived and then stepped back and let them work. And she went to her next patient and the one after that. And the afternoon moved in the way afternoons in emergency departments move. Not forward exactly, more like through one thing and then the next. Each thing its own whole world for the person it was happening to. Around 4, she was at the nursing station when Reyes came up beside her. Reyes had the particular quality of someone who had been thinking about something for a while and had decided now was the time to say it. "I applied for the trauma fellowship," Reyes said. Mara looked at her. "Johns Hopkins," Reyes said. "Level 1 Trauma Center, 2-year program." "When did you apply?" "Last week." Reyes looked at the board. "I've been thinking about it since October. Since the chest tubes." She paused. "Since watching you." Mara was quiet for a moment. "Tell me when you hear back," she said. "Yeah?" "Yes." Reyes nodded. She started to go and then stopped. "Can I ask you something?" "Go." "When you came back, that morning, after they walked you out? She looked at Mara directly. Were you scared? Mara thought about the parking lot, the ground shaking, the smoke column, the keys in her hand and the 40 seconds she had given herself to be angry and the calculation she had made before she turned around. Not of what was in there, she said. Reyes waited. I was scared I wouldn't be enough, Mara said, that there would be more than I could handle and someone would die because of the gap. But you went back anyway. The gap was there whether I went back or not, she said. I just had the option of being in it. Reyes looked at her for a moment. I want to be the kind of person who goes back, Reyes said. You already are, Mara said. October 15th. You stayed in that room. You placed those chest tubes. You asked what you could do, and then you did it. She met Reyes's eyes. You just didn't know you were that person yet. Reyes held her gaze for a moment that was slightly longer than the conversation required, and then she nodded once, a small private motion that meant she had heard it and was filing it somewhere real, and went back to her patients. Mara turned back to the board. The afternoon board was full in the ordinary way of October Wednesdays, the ordinary accumulation of ordinary emergencies that were not ordinary to the people inside them. A fall injury in Bay 1, a pediatric fever in Bay 5, the abdominal presentation in Bay 2, now transferred to surgical prep, a chest pain presentation in Bay 7 that was being worked up and would likely be discharged, the ambient hum of a department doing its work, moving through the gap between what the body can sustain and what it cannot, one patient and one decision at a time. She had a credential card in her pocket. She had a triage log in her pocket. She had 9 years of this department in her hands and 4 years of something else underneath it. And she was beginning to understand, a future that was going to look like a combination of both of those things in a shape she had not designed and could not entirely anticipate. She was 34 years old. She was not finished figuring out what she was. The thing about being told you are less than you are, and she thought about this sometimes, in the spaces between patients, in the quiet of early mornings before the shift found its rhythm. The thing about it is that it only works if you let it become the truth. Someone has to agree to be smaller. Someone has to take the assessment in and live inside it. She had not agreed. Not on the morning the badge hit the floor, not in the parking lot with the ground shaking, not in any of the hours after. She had not agreed, and that was the beginning of everything. The board beeped. Base 7, the chest pain workup, was flagging for a tracing change. She moved. That was the thing she had learned, and the thing she kept learning, in every environment she had ever worked in. You move toward what needs you. Not because you are unafraid, not because the outcome is guaranteed, not because the calculus of risk always comes out clean. You move because the gap is real, and you have the option of being in it. Everything else, the credential, the recognition, the formal record of who you actually were underneath the title they gave you, all of that was real and mattered and had been hard to get here. But the movement came first. It always did. She pushed open the bay door and went to her patient.